good deal. I think it is. So we're going to run through some health questions, like we're on the phone with people. It has been a very, very, very long couple of weeks. Been working till at least midnight, at least like last night and the night before, answering questions that have been coming in. Can't keep up with absolutely all of them. That's why we have a very good, awesome, actually, team of dedicated people. You'll see here, so I can get to them. There's our dedicated group of people that are back there processing applications, helping people, answering questions as we go. And we're doing our very best to be all things to all people. I know that's kind of impossible to be all things to all people. I'm going to share with you today some of our limitations and some of the things that you need to know so that you're not behind the 8 ball and that you are not left out in the cold on something that you could have done that you should have done. That's what we're going to go over. So I'm going to go to a question that came in yesterday. There's sometimes a process and a course of action that you have to go through when you're doing things with Medicare. They have to be done in order. This particular person wrote to me last night, did not do things in order and risks having no coverage whatsoever with their Medicare. So as a result, I want to share this with you. And so hopefully this does not impact you and you don't have the same kind of thing happen. She said, last week I called Medicare about extra help with Part D. And that's if you're in a lower income, you can call Medicare. You can see actually online what the income thresholds are for 2022. And if you have low income, you can get help with your Part D, even get help with your Part B premium payments of Medicare. It's not a hassle to apply for it. You can do it with one simple form online. And we'll talk about more of that in 2022. But anyway, she called to ask about help with extra help, they call it. They changed her Part D provider for her. Okay. I also asked the young man to change me back to original Medicare from my Advantage plan, and he did. Well, he didn't really. What really happens is if you sign up for a Part D drug plan and you were on a Medicare Advantage plan, that's a Medicare replacement private plan, you were on an Advantage plan, and you go and sign up for a Part D drug plan during this period of time, that's the annual enrollment period from October 15th through December 7th. If you're on Advantage and you go sign up for a drug plan for next year, it automatically kicks you off of that Advantage plan. So it's gone for next year. So the guy didn't do that for her. He just probably told her, hey, now that we put you on a drug plan only, it's going to take your spot of your Advantage plan for 2022. I called today to change back since I watched the video on health underwriting. We have a video and I'll tell you the links for that. I'm going to give you a lot of resources here. You may want to grab a pen if you're on Medicare. You may want to share this live stream with somebody else if they're on Medicare. And if you're not on the live stream, you're watching it later, I will have in the description below a list of all the questions, or at least most all of the questions. So you can highlight that and zip right to that part of the video. It's very convenient. She called and, she watched the health underwriting video that I have at seniorsavingsnetwork.org/underwritten. And there you can see an overview of how health underwriting works if you want to be on a Medicare supplement plan. And most of all, this is for people who are on Medicare Advantage. They want to get rid of that HMO limitations and restrictions. They want to go back to original Medicare with no limitations, no restrictions, no prior authorizations, no referrals, no networks, and then they want to get a supplement. But in this case, she pulled the trigger, fired the gun too soon. She called to change back to original Medicare. Then called to change back to the Medicare Advantage plan after she saw that she might not pass underwriting. She convinced me to keep it as it is. This is the person at Medicare. Keep it as it is. That's original Medicare with no supplement and no Advantage plan. And that I don't need an underwriting. Well, that's because the people at Medicare.gov know absolutely nothing about Medicare supplements. Medicare supplements are regulated through the states. So if you call Medicare people at 800-633-4227 for Medicare, and you say I want a Medicare supplement plan, they will know absolutely nothing about that. Their job is to get you into an Advantage plan and get you the heck off of Medicare and get you out into a private plan. They have no information whatsoever on Medicare supplement. That's why you need an independent broker. That's what we do for a living, and our service costs you nothing. I'll share that with you in a minute. So she tried to go back to her Advantage plan, and they wouldn't let her do it. She convinced me to keep it as it is. That's called being a lazy government employee who said, no, you've already done something. Just keep it as it is. You're fine. You don't need to do anything. Just leave it. You'll be good. Really? With just a Part D drug plan, just original Medicare, and exposed then to 80% of all your outpatient costs with no out-of-pocket maximum limit, no limit whatsoever on your cost. That's not a good place to be. And yet, because she didn't talk to us first, she did it out of order. She dropped her Medicare Advantage plan before going through the underwriting process to see even what it is. So now she says, now I'm wondering if I messed up switching before getting a Medigap plan. Yes. So January 1, I will have Medicare Part A, Part B, no supplement, and no Advantage plan. What do I do now? So here's the answer to that. Whatever you've done during this annual enrollment period, it doesn't matter. You can still go do something else. What does that mean? If you signed up for a drug plan and then you find out, hey, I found a better drug plan since then, you can go sign up for that, the new drug plan. And the last application in before December 7th at midnight, that's 3 a.m., which is when I'll be working till, on December 7th, because it's midnight in California where we have a lot of clients. The last application in to Medicare electronically or an application through an agent, the last application in is the one that will dominate your account as of January 1. The last one in is the one that goes into effect. So if you signed up for a Medicare Advantage plan, you say, you know what, I changed my mind. I want a drug plan only. Go sign up for the drug plan only. Do it before midnight, 12/7, and the last application in should be the one that takes effect on January 1. If you sign up for a drug plan, the premium doesn't look right, and you're not getting an income-related adjustment based on your income 2 years ago, where they jack up your rates specific to you because of your high income. If you accidentally signed up for the wrong plan and your premium looks goofy, go sign up for the right plan. I have a super easy way you can do that. It's at our website, and I'll give you these links to write down where you can write it from the screen here later. But our website where you can sign up for a drug plan, so easy on your own, real easy, is startpartd.com. Start Part D. Part D means your drug plan, part of Medicare. Startpartd.com. Interesting question yesterday. Somebody left a voicemail 11 p.m. last night and said, I'm going on Start Part D to sign up for my drug plan, but it's asking me for my Medicare number. Do I really have to give my Medicare number to sign up for a Medicare plan? Yes, unfortunately you do. That's how Medicare identifies you. So on startpartd.com, once you're in there, you'll see it's a secure site at the top. It's encrypted, totally safe. And if you already know the drug plan that you want, you simply put in your zip code, look at the plans, click on Add to Cart, Continue, Enroll. If you're on Social Security income payments being direct deposited for you, on your drug plan or Medicare Advantage plan that might have a premium, those drug plan premiums can come right out of your Social Security. Now, it takes a couple of months for those to get set up correctly. Another question this morning at 3 a.m. was, they wrote to Robert in here and said, hey, I was on Humana last year. I'm going to SilverScript this year, or vice versa. Do I need to let my old company know that I'm changing to the new company? Because I don't want my old company going into my Social Security. I want my new company doing it. That does an automatic change. You never have to go back to your old drug company and tell them, hey, next year I got a new drug company. Those payments are administered through the Social Security Administration. And when they do, they stop one and they start the other. You don't have to notify your old company. That's a little bit different in the world of Medicare Supplement, where if you're approved for the new Medicare Supplement, we will, if you're our client, remind you that once you're approved for the new Medicare Supplement, on the day that that takes effect, you will have need to cancel your old Medicare Supplement because you can't have more than one. So what my point is here is it pays to go in order, to do things the correct method. And that's what we help people walk through so that they're not on their own. If you have any questions that I can help to answer, again, this is the opinion of a licensed insurance agent, and I don't work for Medicare. I don't work for the U.S. government. We are licensed through the insurance departments to help with Medicare things, and we have training on that every year. But I'm not an employee of the U.S. government or of any government anymore, thank God. But your questions, if they're all asked off to the right, does not mean I'll guarantee to get to your question. And if I haven't, I apologize for that. We have the limitations of a live stream going out to folks, and we can't get every single thing in. But I encourage you to ask that question off in the live stream. The biggest questions we've been receiving is, can you sign up for a Medicare Advantage? Is it too late to sign up for a Medicare Advantage right now? One second. So if it's before December 7th at midnight and you're watching this, no, it's not too late. All the call centers are probably going to be open. You can go to Medicare and do it. Medicare's open 24 hours a day. You can go to the Medicare Plan Finder tool, which is on Medicare. They can do it with you. You can also go to our tool, which is Medicare Advantage MedicareAdvantageNearMe.com, MedicareAdvantageNearMe.com, and you can sign up for an Advantage plan. You can see what are available in your areas, and you can compare plans side by side. And if you want to, you add that plan to cart and you go simply enroll. So no, it's not too late. Thank you. As long as it's before midnight of December 7th for you to enroll. That's my wonderful wife, Nicole. It's not too late for you to enroll in a Medicare Advantage plan if you wish to do so. Now, before you do so, I would highly encourage you to get educated about Medicare Advantage and what you're giving up and what world you're going into. There are some benefits and there are some lots of limitations on Medicare Advantage plans as a whole, specifically with regard to prior authorizations, and see what the American Medical Association, the American Hospital Association, the American physicians that deal with diabetes and hematology, what they all have to say about prior authorization and how they're really detrimental if and when you ever really need care of any length. That's a problem. But you can get all that education at a website I made, and I'll give you a list of these at the end. Might go back to them, refer to them several times, but it's called allaboutmedicareadvantage.com. Allaboutmedicareadvantage.com. Important that you hear from the doctors, see what the specialists have to say. There's a cancer treatment specialist, there's an orthopedic surgeon in there. See what they have to say about working with managed care and opting out of your original Medicare for a Medicare Advantage plan. But the answer to this, is it too late for Medicare Advantage? Not until it's midnight. If it's midnight on 12/7 or thereafter, you have to wait till your next period. Now, there's some exceptions to that. We'll get into a few of those. Is it too late to sign up or change your drug plan? No, it's not, as of the day of this live stream. If it's after 12/7 midnight when you're watching this, the next period for changing your drug plan is the new annual enrollment period, which is October 15th through December 7th of every year. A couple of exceptions worth noting. If you're on a Medicare Advantage plan and you want to go back to a original Medicare plan, then you can sign up for a drug plan as well. But for most people, it will be too late as of midnight. You can still go to our website, as I mentioned, startpartd.com. Type in your zip code. You don't have to put in all your drugs in pharmacies. So many people now are very healthy. It's wonderful, especially if you're 65 years old and so forth, very young. You take no medications, or the ones that you take are very generic. They're very simple drugs. Yes, it's possible to not put your drugs in, not put your doctors in. Don't put anything in, no pharmacy, nothing. If you want to, look at the list of drug plans. It'll be sorted by the lowest monthly cost, and just click add to cart and enroll. You can do that in 5 minutes, especially if you just wanted to come out of your Social Security. You can also have it come out of your checking account if you wish. And again, that's a secure site. Deadline on changing or starting a drug plan is on midnight, except for certain cases, and we'll talk about those next. Is it too late to sign up or change your Medicare supplement? No, it's not. You can sign up or change your Medicare supplement plan 365 times a year. Now, we don't work 365 days a year, but you could technically sign up for a Medicare supplement or change your plan or compare your plan or think about changing your plan absolutely any time of the year. And what happens in our office is we get so many people that try to do this Medicare supplement comparison, over 100 that I've talked to in the last 48 hours, who say, I have been a client of yours for a long time. I heard on the news about 50,000 commercials that I need to do something with my Medicare. I love my Medicare supplement. I don't need to change it, but can you call me and let's just go over the Medicare supplement options right now? And it's the 6th of December. No, we can't. We just have absolutely no more capacity between now and the finite end of business period on 12/7. It doesn't matter. We can review your Medicare supplement any time of the year. So we have a neat new calendar system we've been using this year, and people are booking their times on the calendar to go over those options for Medicare. If they need to be underwritten to look at a new plan, they go to seniorsavingsnetwork.org/underwritten, and you can see what underwriting's like. You can book a time on our schedule, no problem. If you're an existing client with us at Senior Savings Network and you wish to review your plan, it doesn't matter if your plan renews in February or June or July or next November. You can review and change your supplement plan any time of the year. The only question is, can you qualify through underwriting? And you can see that at seniorsavingsnetwork.org/underwriting. There's no constraint, no time limitation whatsoever on getting a Medicare supplement. There's just not. So if you've left us a message in one of the hundreds that have called in the last 48 hours to say, please call me to go over all my Medicare options, and we're not able to get back to you. It's because we're trying to prioritize the people who have a drop dead deadline of getting something done by 12/7. We're doing the absolute best we can. And it's not just our agency, it's every agency across the country. We've been getting communication from all of them that so many people have waited to the last minute, but there is no last minute because they're just doing a Medicare supplement. So there's no deadline on that. There's no deadline of December 7th for a Medicare supplement. And it says in the bottom there, you probably can't see it. Do not panic. There is nothing you need to do for a Medicare supplement right this minute. Okay, I signed up for an Advantage plan during this annual enrollment period, probably from watching Joe Namath or poor Bill Shatner on there, or Sarah Palin, or all these poor folks getting on there to pitch Medicare Advantage. Anyway, I signed up for an Advantage plan during AEP, and you've changed your mind. I want to go back to real Medicare. What can I do? Like the first lady who wrote to me last night that I showed earlier, I would not just run out there and drop your Medicare Advantage plan right now. Why is that? Because if you have given up your old plan or you didn't have one to begin with, it's better to have a Medicare Advantage plan than not have anything at all. So I would keep your Medicare Advantage plan ready to go for January 1. And then we can talk about what your options are after that. There's no hurry, because what people don't understand is if you want to start a Medicare supplement plan or change a Medicare supplement plan in most all states, you have to be underwritten first. And all that is a series of questions that we go over, and I have it there on the website. And based on your answer to those questions, we can get you approved for a great plan or not. But there's no time to get that done and know before the Medicare Advantage window closes on December 7th. We'll talk about other options in that regard, but my advice to you right now is if you've changed your mind and you can still get your supplement active, yeah, sure, go cancel your Advantage plan, get your supplement back if you hadn't canceled it yet, and sign up for a standalone drug plan before midnight. So again, your drug plan then would be the last one in, and it's the first one that takes effect on January 1st. If you have questions on that, I'll go to the questions here in just a second. Here's a huge tip, hundreds of voicemails I've seen in the last 48 hours. If you leave us a voicemail, please leave more than just your name and your phone number saying, call me back. If you can tell us what you need, and now probably 95 or 99% of our clients have texting on their phone, and we can send you the answer to your question by text in 3 seconds, and you're good. You've got that question answered. And as we're going through triage with literally thousands of people in these last waning hours, if you've left your question in the voicemail and you say, hey, you can text me an answer, then we can text you an answer. And in many cases, because I've made so many website resources to answer things for people, we can send you a website with a video that goes through it, the exact answer that you're looking for, and you can pause it and go back, and you can use resources there. And I've got the Medicare.gov documentation. So whatever it is you're calling us about, if we don't jump on the phone because our feet are not up on the desk waiting for a phone call, please leave us why you're calling so that we can help you. So many of them yesterday said, I just have one question. And if you can call me back, I know you're busy, but if you can call me back, here's my phone. I just have one question. Well, if you could just tell us what the question is, we can probably most definitely get you an answer in real time rather than having to go pick up the phone. And guess what? There's already another person trying to call in when we go to pick up the phone. So we want to get you the best information possible. And if you're a client of ours, we already have your email. We will email you and text you and say, please check your email because I just sent you the question answer that you're looking for. Many times people want us to get set up for a review of their plan, and we can send them the booking link, which means you jump on our calendar and we don't miss those appointments. It's a very good thing to use. Another tip, we send major notifications to all of our clients every year during the annual enrollment period. I sent out an email personally to every one of our clients on October 15th. Again, I sent it on October 18th. And again, I sent it on November 3rd. So if you look for an email from Christopher Westfall at seniorsavingsnetwork.org, you'll see our email, which is all the updates for Medicare coming up. And that's a service we do for all of our clients. But so many people have called in, and then I'll send them that update email again. They're like, oh yeah, I found it in my junk folder maybe, or I found it in my spam folder, my promotions folder, whatever it is that your email, put it in. But if you're a client of ours, look through your email for my name, Christopher Westfall, and see if you got something in there, then you will have most all the answers that you're looking for. And let me see if I can put something on here. 1 second. questions, put them in the comments of the live stream. Where's the one I was looking for that has, there's a name. So that's the name to look for, Christopher Westphal. Is it too late to start, if you're starting Part B in 2022, to do something by December 7th? So a lot of people are leaving their employer plan on December 31st. You don't have to do anything by 12/7. The December 7th deadline has nothing to do with you. If your life trigger date, whether that's starting Part B, leaving your employer plan, starting onto Medicare for the first time, having a birthday next year, all those things that are specific and unique to you, that means that the 12/7 deadline, that's for the 54 million people already on Medicare, that does not apply to you. You get your own special happy window, your initial election period for starting on Part B, your special election period for leaving an employer plan, your IEP2, if you're in Europe and you stopped Part B, you're coming back and you're starting Part B. There's so many things that are unique to you that if you're doing anything new with Part B next year, starting it or leaving an employer plan, starting it, turning 65 and starting it, no, 12/7, December 7th, midnight has nothing to do with you. And you don't have to try to cram into this time frame. It'll be much more expanded, a lot less stress, and more options that we'll have time to go over at your leisure. And you can book a time on our website for an easy appointment. So we have nothing but you to focus on. So if anything new is happening for you next year or more than 6 months out, certainly don't have to do anything now. If it's within 6 months, we can look at your options and go over those with you, because the accurate rates for Medicare plans are 6 months before the actual event happens. So 6 months before your Part B happens, I can tell you what the Medicare supplement rates would be and what the market looks like 6 months ahead. But beyond that, we call those early birds. Like if you're turning 65 in October of 2023, there's no point in even looking right now. I mean, you could book it on your calendar, but I would book it for 6 months out. Another common question, is it too late to get a dental, vision, hearing plan? No, not at all. A couple of resources we have, I'll show you at the end of the presentation today. You can get a dental, vision, hearing plan any time of the year that you want to. We have a couple of favorites out there due to client feedback and the fact that I own them and they work very well for paying claims. You can look at the most popular one. It's not in every state, but it's the most popular one by far is at AmericanDentalCoverage.com. AmericanDentalCoverage.com. It is a dental, vision, hearing plan that has no network. Well, I guess it does have a network that you can opt to use if you want to for more discounts, but you don't have to use a network at all. You can use any dentist, any vision care provider. And I'm talking about optometry, glasses and refraction, all that stuff. And hearing aids right now. Don't have to wait for it to possibly be in the Medicare law next year. So a dental, vision, hearing, all these things into one bucket that you can use. It's in this plan. It's very, very popular plan. And depending on your state, they have a benefit available of $1,500, $2,000, $3,000. But you can see those at AmericanDentalCoverage.com, and you can book an appointment with us for any time to look at dental plan options at another one, SeniorSavingsNetwork.org/DVH, dental vision hearing /DVH, and you can schedule that time. But December 7th has nothing to do with dental vision hearing plans. Also, little known fact, those are not underwritten plans. Anybody can start those plans or stop them any time of the year. There's no underwriting for dental vision hearing plan. Now, the ones that we represent get better and better and better over time. They start off really good, and then you get more coverage and more coverage and more coverage the longer you keep them. It's like a loyalty benefit program. Okay, I'm going to look at these questions. I'm going to pull your questions into the live stream. While I'm doing that, if you've not yet done so, please do me a favor. It really helps the YouTube thing to push our information out to people that might help more. If you've not yet subscribed to the channel, please do so. And if you're watching this video, please do me a favor and hit the like button. I don't make everybody happy all the time. I will own that. Absolutely true. But if there's anything in here that is of any benefit to you during the whole thing, or if you appreciate the work that we're trying to do working around the clock to help people, please hit the like button. And if you hit the notification bell, you'll be notified of live streams like this one in the future. Please share this information of the channel, even if you're not our client, even if you have no interest in being our client ever in the future, doesn't matter. I want to help everybody out there. Not all of the 4 million plus viewers that we've had over the last, 5 years on YouTube. Over 4 million now. That's crazy views. Not all of them are our clients, but we've helped a whole lot more people than it would lead to. Anyway, so let me look on here. And it says, Betty Boop. Just want to let you know, I spoke with Gabby last week. She's awesome. Signed me up for my supplement plan. Oh, that's awesome. It was an easier choice to make due to all that you do. Thank you so much. Let's see. What does AEP stand for? The annual election period. Some people call it the annual enrollment period. Medicare interchangeably calls it the open enrollment period, which it's not. But it's the annual time where you can make decisions, and that's October 15th through December 7th. It only has to do with drug plans or Medicare Advantage. It has nothing to do with Medicare supplements whatsoever. Hi, Christopher. What happens if you don't get Plan D? You're talking about Part D of Medicare. There's a distinction between parts and plans. Plan D is a specific Medicare supplement plan. It's not very popular, but Part D, the drug plan, if you don't get a drug plan and you don't have other qualifying coverage, and that could be that you're under 65, didn't need it, or you're over 65. Okay, fine. So you can take a break. If you're over 65 and you did not get a drug plan 5 years later, and you don't have an employer plan to back you up, 5 years later, you say, you know what? I think I'll sign up for a drug plan. What they'll do is they'll sign you up for a drug plan if you want during this period of time, the AEP period, but they will go back until the time you were 65 years old, the time that you should have had a drug plan in their estimation. And they'll charge you a penalty of 1% per month going back. So if you waited 5 years, they'll charge you a 60% penalty. And what it is technically, it's 60% of the average premium across the country for what Part D plans charging out there. So it's not just 60% of your premium, it's 60% of the average premium, which is typically more than most. That penalty never goes away. So the benefit, the encouragement to you is, if you don't have a drug plan, get one as soon as possible, unless you have employer coverage that gives you a waiver for it. And if it's qualifying employer coverage, you don't have to do that. Many, many employer plans are better than Part D drug plans. They just simply are. So if you have a drug plan through your employer, then you don't need a drug plan. But once you leave that employer, you need one within 62 days of leaving the employer, or else this penalty could kick in. So that's the deal about the Part D drug plan. I encourage people who are taking no drugs whatsoever and they're turning 65, or they're just coming on to Medicare for whatever reason, at least get the least expensive plan. And like I mentioned, you can do that very easily by going to startpartd.com, put in your zip code, see the cheapest plan, do enrollment, and you're done in 5 minutes. And if you're drawing Social Security, it can come out of that check. If you want to pay by direct deposit, you can do that too. Let's see. And then folks in the chat are even answering the other people's questions in the chat. That is awesome. What are these flex cards they keep advertising? It is another lure to try to get you to give up your original Medicare. That is the truth. A flex card is something that these insurance companies on Medicare Advantage, their private plans, they're given so much money, up to $1,000 a month in some cases, to take you off of original Medicare. And the government says, I'm done with you. I have no more responsibility to take care of you. So the health plan has a finite set number of dollars that they have to deal with your health plan, all your health care needs. Some of that they pass on to you because those are pay-as-you-go plans. Huge co-payments when you go to the doctor. No coverage if you go outside of the network unless it's an emergency, and then you better get yourself back to a network hospital once you're stabilized. So many restrictions on care because they've already been paid one specific dollar amount for your coverage. Well, on the flex cards, that's when they're trying to lure you from the other competition by saying, well, we have so much money given to us by the government. We're going to give you a card that you can go into the pharmacy and get some over-the-counter junk. You can get some hydrogen peroxide. You can get some Band-Aids. You can buy a new toothbrush with this card we're going to give you as a bribe to give you back some of the money that we're being paid by the government. That's just simply a fact. Let's see. I feel like getting scammed by Medicare Advantage. Cigna, they're charging me for not having a prescription with the previous plan. That's not Cigna doing that. That's another very good point. The Medicare system has pushed into the private role the policeman of this Part D drug plan penalty that I just talked about. We often see this and we constantly have to remind ourselves that when we're helping somebody come off of an employer plan for the first time joining Medicare, no matter what your age is, we need to let you know that when you're leaving an employer plan and you're older than 65, your new drug plan carrier is going to send you a scary letter that says you could face a penalty for the rest of your life. You need to provide us with proof that you had qualifying drug plan coverage going all the way back to age 65. Now you're saying, why isn't my carrier asking me this and not Medicare? It's because Medicare put it on them to gather this proof and report back to Medicare. Somebody was mad at WellCare 2 days ago for the same thing. Why do I have to tell WellCare that I was working and I had qualifying coverage? I already proved to Social Security this information, and that's how they let me start Part B later than 65. I understand that. But Social Security doesn't talk to the drug plan people. So Medicare says, we have no record of this person being on a drug plan going back to age 65. Hey, you, new drug plan carrier who want this as a client, you're going to collect the overage and the penalty, or else you go back to the client and say, I need proof of your continuing coverage of all those years. Now, every year you should get from your employer past age 65 a certificate of creditable coverage. You need to keep that. If you've not kept that, go back to your employer and say, I need a certificate of creditable coverage for the time that I was with you past the age of 65. Simply show that within the time frame allotted from your new drug plan carrier, and you should be fine. Sometimes they don't even ask for it, the carriers that don't have their stuff together. But Medicare puts that rule onto, that burden onto the drug plan carrier and says, go ask your new person where they've been since age 65. And they better show you proof, or else we're going to give them that penalty. And you, the drug plan, Cigna in this case, or Express Scripts or whatever, you're going to have to collect that money. So it's not Cigna being mean to you. It's literally Medicare putting that job onto Cigna to go do that. I wouldn't be mad at Medicare, but if you didn't have a prescription drug plan and the other plan, you don't have to do anything. You're just going to get the penalty, sadly. Let's see. And it's not a scam. Nancy says, please explain denial and underwriting for COPD. Is that only for patients with oxygen? Usually it is. If you're on oxygen and you're trying to go through underwriting, then most companies will decline it. What insurance companies want to do, just like life insurance and a home insurance program or car insurance, if you're headed for a collision, heading for a fire, heading for a guaranteed claim, and your premiums are not going to reflect the fact that they're going to absolutely pay a guaranteed claim for you, if they can reject you, then they're going to reject you. That's why sometimes when you're getting new homeowners insurance, they want to send an agent out to see if your home is still standing. And sometimes on the car insurance, they want proof that your car was not in a wreck when you go and try to file a claim that you were in a wreck 2 days after getting that insurance. So similar to the fact that you can't buy homeowners insurance if there's a hurricane headed toward your house, because you can't. If there's a named storm, then there's a freeze on all new insurance. Why? Because people often wait until there's a crisis and then they want to go get insurance, and insurance is not that way. Insurance is a risk pool of a lot of people that are generally healthy, subsidizing those who for a rare occasion are not. So that's why they will decline people with certain bad health conditions. And if you want to see what those conditions are, you can go to seniorssavingsnetwork.org. Let me go to a couple of these here. What are they about? Slide 28. Right here. seniorssavingsnetwork.org/underwritten. And you can see that. Let's see. I've got a whole bunch of these resources here I'm going to put on the screen while I'm answering questions. These are websites that we have that I've made that have made such a difference in making people's lives easier. If you want to see what's involved in the underwriting process for someone who's not brand new to Medicare and you want to get a Medicare supplement, go to seniorssavingsnetwork.org/underwritten. Video there will explain how Medicare underwriting works. And there's got a red and a green button on there, and you can click on it if it's green. If you think you'll qualify, hey, get on our schedule. We'd love to help you. We're all across the country, and our service doesn't cost anything. If you're in open enrollment, that means you're 6 months away from your Part B start date, 6 months before Part B starting, or you're still within 6 months of Part B having started, then you're in the Medicare supplement open enrollment period. And we can help you without any underwriting whatsoever. You jump on our schedule, we help you with the best plan, and we get you signed up. Again, our service doesn't cost anything. So this is the schedule that'll jump you right into our calendar. If you're a current client, you want to look at renewal options, this explains that and get you on our calendar through the appropriate team that handles that. You're looking for a drug plan, start Part D. If you don't know what Plan N is, which in my estimation is the best plan for a vast majority of people, look at the research at plannmedicare.org. And then if you want to save money on your gas, which I've given just the other day, hit $1,800 back on my gas card, which is really neat, goes right into my bank account. You can look at this. So let me go back to the questions here. I ain't doing it. Said, I called Thursday and left a message, haven't heard back. Only have till tomorrow. I'm sorry. We cannot call back the thousands of people, especially if we don't know why you called or if you're doing something that has nothing to do with 12/7. That's what we're in the middle of right now is triage. We have 700 people to call back within, how many hours do we have between now and then? 16 hours. Doing the absolute best we can. If you left us a number we can text you, then we're probably asking you questions. Look for that. If you said something like, and I don't even know your situation here, but if you're turning 65 next year, if you're leaving employer plan next year, if you're doing something that's a next year thing, no, we have not prioritized your call from Thursday to the top of the list. Or if I can look at my notes, we probably see we've left message. But yep, can't be all things to all people. Wow, look at that. Lily said, what is this program that the Trump White House started with Medicare called DEC Private Insurance and Wall Street Investors? I guess trying to privatize Medicare. Lily, if you stick around to the end of this, I just pulled a video off of the Newswire today about that. I covered that in great detail in a prior live stream. And there is some news about that with the Biden administration that will absolutely shock you. So stick around to the end of this presentation. I'll play it at the very end. If you're watching this again in the live stream, in the replay, go all the way to the end. You'll see that video where they talk about that very thing being continued in the Biden administration. That's not a Republican thing. It's a coming Medicare thing. Sarah said, I have an Advantage plan right now and want to see if I can change the plan in like in your video, but I don't feel like I have time left. Do I have to wait till October of next year? No, you don't. Let me go to where I covered that a few weeks ago. And I'm just going to show you a slide from Medicare.gov. Since you asked, you're on an Advantage plan and you want to see if you can go back to original Medicare with no restrictions, no prior authorizations for procedures to try to save them money. Wow, Air Force 2 flying out my window. That's pretty cool. We're in Charleston, right outside the airport, and I watch the fighter jets and everything fly around. That is neat. Sorry, squirrel. No, it's not too late for you. It would be too late for December 7th if you were going to try to get everything done by December 7th and have it start January 1. Yes, it's too late for that. Not because of us necessarily, although we are crammed. It's because we need an underwriting decision first before we have you pull the ejection seat on your Medicare Advantage plan. We're not going to be irresponsible and say, yeah, just ditch that plan. We'll figure something out later. We would need an answer from underwriting before 12/7 so that we can start you on a drug plan for January 1. We'd like to start you on a drug plan for January 1 at the same time your supplement starts. Now that it is too late, what we could do, we have the Medicare Advantage open enrollment period, which is another horrible moniker given by Medicare. It's really the disenrollment period for Medicare Advantage. And this period of time starts every year now from January 1 through March 31. From January 1 to March 31. So you can relax, breathe easy. The plan that you have right now will continue to be your plan as of January, but we can submit an application as early as January 1 so that we can get you through the underwriting process and answer those questions. If we get you approved, then and only then, doing things in the proper and correct order so that you're not at a disadvantage, then we get you on a drug plan, which Medicare allows. And then we help you with the Medicare Advantage plan cancellation. We get you all set up for a Medicare supplement. So you have the freedom, flexibility to go anywhere that you want to without a health plan telling you what restrictions they're going to place on you for that care. So it's important you do those things correctly. If you go to my website called seniorsavingsnetwork.org, it's way up there at the top. Click on Medicare Help. You'll see a green button that says, I'm on Medicare Advantage and I want to go to Medicare Supplement. If you click that, I've got a video that goes through step by step by step. So again, even if you're not going to use my service, that's fine. Blessings to you and yours. But at least you'll know the proper method because many new agents don't. And I don't want you to just go jump into a Medicare supplement plan with no answer from underwriting before it's too late. We don't do things out of order. For everything, there's a time and a season. We have to do things in the right order. So this is from the Medicare website right here, there. And it says during this next period of time, January to March 31st, you can switch Advantage plans if you want to. We can help you with that. You can drop a Medicare Advantage plan and return to original Medicare. That's the one that we're talking about. And once you do that, then we can help you get a drug plan, a standalone drug plan if you drop Medicare Advantage. What the Medicare book does not say, and it should have said in here is, don't do this until Chris has helped you with a supplement approval first. So don't just go dropping plans like the lady at the beginning of this thing did, bless her heart. I hope we can still help her, but don't go do things out of order because it could be very detrimental to your coverage, not have absolutely anything. Let's see. You did a video about what you believe the premiums will do in the future under Plan G and Plan N. You did not include high deductible Plan G. What are your thoughts about the future of high deductible Plan G premium? Mike, good question. High deductible Plan G pays claims in only 7% of the cases. That's research done by a leading company that focuses only on high deductible Plan F and high deductible Plan G. Very profitable for the insurance company. It appears to you to be very inexpensive, but in reality, it never pays any claims. Why is that? Because you've got a massive deductible of over $2,400 that you have to hit before the supplement company pays one dime. How often does that happen, that they have a major claim like that and they have to pay something? So seldom, in fact, that they hardly ever, if ever, have rate increases. So sometimes we put people on the high deductible Plan F in years past because they insist on it. They're the scientific accounting, technical type of folks. And they'll say, I've done the research. I'm never going to need this. Put me on the cheap, high deductible Plan G. And then guess what happens? A couple years into it, they'll say, why am I hitting all this money out of pocket? Why am I paying for this supplement that's not doing anything for me? That's because you insisted on being on that plan that pays nothing until you have a catastrophic event. And then you're going to be mad at us because we put you on the plan that you asked for without taking our advice. If you want to pay for insurance that'll do absolutely nothing for you, then buy a term life plan that lasts for 5 years. Those plans never and ever pay out. Why? Because they know just what the threshold is to get you to pay premium where they won't have to pay any claims on the back end. So that's my synopsis on high deductible Plan G and F. Hardly ever see rate increases. Why? Because rate increases are based on the trend of how many claims that they're having to pay. And if they never have to pay any claims, why would they ever have to raise rates? And they don't. Bill said, happy birthday tomorrow. Thank you so much, Bill. I did time, coincidentally, the Medicare end of the season to be on the same day as my birthday so we can celebrate both things and have it as a tax write-off for my company. I'm just kidding. Just so happens to be Pearl Harbor Day, a day which will live in infamy, is the day that my mom dropped the bomb of me on America. Nomad Viking says, Chris, I'm currently on the state Medicaid plan, and due to an expected raise in income, I will need to get off of Medicaid. What do I need to do? You need to call us because in most states, that is a special election period that allows you to get a Medicare supplement plan without underwriting. Washington has some unique underwriting rules that I cover over on seniorsavingsnetwork.org/underwritten. So you can see what those rules are when booking an appointment. But I would encourage you to do that because that will give you a special period of time. I don't know if you've already started Part B or not, but if you have, this may trigger something anyway. If you've not, that we can help with. Let's see. My wife had 3 abdominal surgeries in 18 months through last year. We paid nothing with her Plan G. Hallelujah. It works like we say it works. Now, let me go through there, Tom, real quick on that. If you'd been on a Medicare Advantage plan, an HMO, if you look at some of those summary of benefits, since we're, just for kicks in the Medicare season, like I like to do, I look at plans that are available, like in the area where my mom lives. Had she been on a Medicare Advantage plan, they're charging you, $200, $300, $400, $500, $600 a day for a hospital admission. You go in there for 2 or 3 days per surgery, and then you have the rehab costs and the physical therapy costs and all those kind of things. Thousands of dollars of out-of-pocket on Medicare Advantage, and that's after you go into a network hospital, and that's after you picked a network surgeon, and after you got a referral to a physician, and after you got that surgery prior authorized before any of that happened through the health plan. Thank God you were on a Plan G for that. That's awesome. Jackie, awesome picture on your YouTube profile. If I'm retiring at the end of next year and I've not signed up yet, when do I need to sign up for Part A and Part B by January 1st? If I'm retiring at the end of next year and I've not yet signed up, you don't need to sign up for Part B until, matter of fact, let me show you something that just came out in the news about that. Let me show you. Turn that off just in case I happen to show the wrong thing. There's a story in the news about this very thing. We often get the question, I'm deciding to stay at my employer plan, or I'm deciding to get off of my employer plan and go into Medicare. Which one should I do? And so there's a lot to that, and I want to show you some of the considerations here. And this particular thing is very, very, very sad. Story that was big in the news with CNBC. Make it so you can see it here. But this is part of your consideration. It's part of your calculation. I mentioned before that employer drug plans, if drug plans are important to you, if you're taking a lot of medication, that has to be a number one consideration when considering, do I keep my employer plan or do I go on to Medicare? Because when you go into Medicare, the Part D drug plans, it's a generalization, but it's most often true. The drug plans on Medicare are not as good as the drug plans that are on the employer plans. They're just really not. And that being the case, I would not want somebody to make a decision based on, let me sell you an Advantage plan or let me sell you a supplement plan. We need to look at the drugs to see how that's going to impact you. One man 5 years ago, and I'll never forget this man had a situation where his drugs were going to cost him over $5,000 a month if he left his employer plan. He never took that into consideration. So we have to look at the whole picture when you're making that decision. But if the end of next year means that the end of 2022, you're going to be leaving the employer plan and you're past the age of 65 now, as long as your employer plan is qualifying coverage, and that is typically a group plan with 20 or more, 20 plus employees, where having Medicare is completely optional to you. If your employer plan is less than 20 employees, you better get started on Part B when you turn 65, or you're going to have some real problems. But if you're over 65 and you're working for an employer plan of greater than 20 employees, whenever you're going to leave the employer plan, I'd say within 60 days, go fill out your forms for Part B. You can do that at my website called howtostartmedicare.com. How easy is that? howtostartmedicare.com. I've got to replace that video because I did it right when the pandemic started. It's pretty ugly with me out in the woods, but the information's there. You can click on the resources for the form that you need to start Part B and prove that you had qualifying coverage since the age of 65. And it goes through that stuff. I'm going to add more to that website based on this news story that just happened. But you don't have to start Part B until you're within, I'd say, 60 days of leaving that employer plan. But watch this. CNBC story from this week. My wife sent to me yesterday on Sunday. Thank you. Bless you for looking at the news with me. She said, this article says, Medicare won't let this 68-year-old cancer patient enroll in Part B, and it's costing her thousands. Why wouldn't they let a 68-year-old cancer patient enroll in Part B? I'll tell you why. Scarlett, who's recovering from cancer, has no coverage right now for doctor appointments or other outpatient care. The problem is related to not knowing that a health plan under COBRA, which means not actively employed, is not qualifying coverage as a replacement for Part B. Now, we're trying to get that changed. I'm part of an organization that lobbies Congress for on the benefit of seniors, and we're trying to get that changed right now. But the way the current law is, COBRA is not qualifying coverage. You have to have had Part B if you're over 65. So many people will say, well, I'm on a qualifying employer plan, but I'm going to leave the employer plan and I'll just get on COBRA for a while. It's not treated the same way. I'll go on. Here's her story. The New Orleans resident who's recovering from cancer has been enrolled in Part A since 2018 when she turned 65. Great, we're halfway there. Yet, due to how Medicare interacts with insurance through an employer, coverage she lost in August, she is now not allowed to sign up for Part B until January. Why? That's the general election period, and she'll probably have a penalty. That's the general election period if you forgot to sign up on Part B and you want to do it later. The bad news is it ain't even going to start until July. So yeah, in January, you can sign up for Part B if you waited too long, but it won't even start until July of that year. The story goes on. That's when a 3-month enrollment window for beneficiaries who didn't enroll when they're supposed to, it's a fragment. Even then, however, her Part B coverage will not start until July. And I said that, yeah. As she could face life-lasting late enrollment penalties, 10% per year. 10% per year on Part B if you didn't do it in time. The only out to that, to avoid that penalty, is you're at an employment, you're still actively employed, literally actively employed, not on COBRA, not on a retiree plan, you're actively employed, and you have qualifying coverage from being a group that's over 20 employees. Quote, the Center for Medicare Advocacy attorney said, the rules surrounding Medicare eligibility, particularly as it relates to employer-based coverage, is unnecessarily complicated. Man, I wish there's some kind of an agent who can answer these questions for people. Anyway, with quite unfair results in some situations like this one, said David Lipschultz, Associate Director and Senior Apology. Okay. For most people, 63 million beneficiaries. Long delays before coverage begin or late enrollment penalties are not typical. However, for individuals who have insurance elsewhere when they reach the age of 65, mistakes in following the enrollment rules exactly can be problematic at best and costly at worst. This is why you need the advice of an agent who doesn't cost you anything. Doesn't cost you anything. A bill that cleared Congress fixes the 7-month penalty, blah, blah, blah. It's not in effect. It's not happening, not helping. Legislation does not address the issue that led to, yeah, it's useless to mention that. In her case, signing up for only Part A made sense at the time. She was covered through the wife's workplace health plan, and the rules allow the beneficiaries to delay Part B without penalty if they have qualifying coverage that Medicare considers acceptable. That'd be actively employed with a group of 20 or more employees. The problem arose when she resigned from her job, diagnosed with head and neck cancer, and the couple remained on the insurance under COBRA. COBRA is not actively employed. It's not qualifying care. That law allows you to stay on your health plan for 18 months. Unfortunately, under Medicare rules, everything changes once the insurance is not related to active employment. It's confusing and trips up a lot of people, said David. While her workplace plan was suitable in lieu of Part B, while her wife was working, the separation of employment automatically rendered the coverage now unacceptable. Unfortunately, under Medicare rules, everything changes once the insurance is not related to active employment. It is confusing and trips up a lot of people. So, unbeknownst to her, at that point that she left active employment, she had an 8-month window to sign up for Part B without penalty. 8 months after leaving active employment without penalty. Incidentally, this only tells half the story. The other part of that is you have 2 months to get a Part D drug plan after you leave a drug plan program. 2 months. So you need some help on this stuff. In 2019, 764,000 people paid this late enrollment penalty. Golly, that's ridiculous. Unaware of the rules, she remained covered under COBRA until 3 months ago. She did not qualify for a special enrollment period for Medicare, unfortunately. With no insurance for outpatient care, her most recent cancer-related appointment cost $5,500 out of pocket. And that was after requesting financial relief from the original almost $8,000 price tag. So sad. So it really pays to know when you're going to sign up for coverage, when you need to sign up for coverage. And again, we're trying to get this law changed right now because it's just absolutely ridiculous, but it's not going to get changed anytime soon. And that's why you need the help of an agent. I really do believe that. So anyway, that answers the question of when do you sign up for a plan? I would do it. I would sign up for Part B no later than 2 months before you're leaving your active employment. And again, that's assuming that you're leaving active employment, not a COBRA plan and not a small group plan. Got to do that. I'm also going to talk to you about the new hike in Part B. There's some news in that, but I'll go with that in just a minute. I'm under 60, have traditional Medicare and Medicaid due to SSDI in Utah. Please, is there any advice you can tell me on how to get bifocals? Bifocals? No, because that's under optometry, which is not covered under original Medicare. However, if you are on, that's a neat picture. If you are on Medicare and Medicaid, you are eligible for what they call a dual eligible plan, which is a Medicare Advantage plan, often much better than a regular Medicare Advantage plan. That's only available to people who have both Medicaid, low income due to Medicaid, Medicaid and Medicare together. They pool the money of the state and the federal government together, often resulting in no co-payments, less restrictive networks in some cases, many things covered at 100%. So I would look into dual eligible Medicare plans. You can see those at MedicareAdvantageNearMe.com or by calling Medicare. You have until December 7th to do that, even if you're under 60. So dual eligible plans, if you're on Medicaid and Medicare, often a very big benefit to you. Thanks, George. Let's see. I passed underwriting for a supplement plan and was issued a policy number to start January 1. Currently on a Medicare Advantage plan, I'm confused about when to sign up for a Part D to avoid problems with my new plan. So as we were talking about before, the difference. And if you want to see it in slow detail, go through it, look at the video that I have on the Medicare help section of, let me show you where that is. I'm live, I can show you. You go to seniorsavingsnetwork.org, like, there it is. All right, it's going to load here in a second. Showing myself there. And go to Get Medicare Help at the top. What's this? Get Medicare Help here. I go through these options. You click on Medicare Advantage to supplement. I want to go on from Medicare Advantage to Medicare supplement. What do I do? And so this talks about the entire process of going through it. I actually have in here some cool little graphics that show what to do first, what to do second, and when to do it. So you can see it in these graphics. This is the order in which to do things. And again, you just go to our website, Senior Savings Network, click on Get Medicare Help here, and select what you're going to do. The short answer to what you're trying to do is you need to sign up for a drug plan before December 7th. If your new supplement starts January 1st, you need to get a drug plan ready for also January 1st. You don't want any break in coverage. So to do that, you can either go to startpartd.com, you can go to Medicare, but those are your options. You've got to get that drug plan started and got to do it by 12/7 to make sure that you've got a drug plan in effect for January. Now, if you've not canceled your Medicare Advantage plan, don't worry about that. Why do I say that? Because signing up for your drug plan will also automatically cancel your Advantage plan because you can only have one of those two slots with you in Medicare. Kind of cool. So signing up for your drug plan will kick out your Medicare Advantage plan automatically. But for those who missed the earlier part, don't do that if you want to supplement until you're first approved through underwriting for the supplement. And that's something we can help with. Cool. Please explain the 144 monthly kickback. Who would benefit? So the monthly kickback is a bribe, again, paid by excess profit from the Medicare Advantage company. In some cases, they're not available everywhere. It's available in some cases where you can get up to 144. And why is it 144? Because that's the amount that they were allowed to give back under Medicare rules back when Part B cost $144. So they were essentially giving you your money back because they made so much profit from Medicare. What you'll often find with those programs is when you're getting that money back, you're also paying higher in copays, hospital charges, maybe more restrictions, and maybe a more limited network, because with that finite amount of money, they have to pay for all your health care as well. And they're also giving you something back as a bonus to be competitive, to lure you away from the competition. But often cases, many times, you'll look at a give back plan next to a non-give back plan, and you'll see that the non-give back plan has more benefits for you. One of the worst things about Medicare Advantage that I see is people sign up for it when they're healthy and they don't want it when they're sick. So when you look at the summary of benefits on any plan, look at the worst case scenario. When you look at your deductible, you look at your homeowner's coverage, you look at your car insurance, always think about the worst case scenario. Do you ever have that friend who was in a major crash, had major lifetime injuries, maybe they were paralyzed for life, and they had the minimum standards on car insurance, just the minimum, like 10,000 PIP or whatever it's called? They really would have wished they had better coverage. So when you're looking at any plan of any kind, except for the supplements, because there is no limit on their benefits that they pay for you, there's no restrictions, no networks, nothing like that. So you can't really compare. But in Advantage plans, you darn sure better care what's in the small print. And again, please look at allaboutmedicareadvantage.com, and you'll see what I'm talking about, what some of those concerns are. Not the least of which are what happens in a worst case scenario where 1 out of 3 seniors gets cancer over the age of 65. Look at the chemotherapy benefit. Just look at it. Just look at the chemotherapy benefit. And it'll say 20% of all approved charges. So that means two things. One, they're only going to pay 20%. That's like having no coverage at all. I'm sorry, you're going to pay 20%. The approved charges means you have to go in their network. You have to go to their chemotherapy place, not to the oncologist that may be the best in your county or the best in the country for that matter, which you can on a supplement, original Medicare. But of approved charges, you have to pay 20%. That's a big, big number of chemotherapy costs. And then the sales agent for Medicare Advantage will say, yeah, but you're protected by the out-of-pocket maximum. Right. And so when my family member had cancer, it happened at the last quarter of the year. So guess what that did? It rolled into the next first quarter of the year. So nowadays, the max out of pocket you can have on Medicare Advantage plans is $7,550. It varies in some states, it varies in some plans, but the max that Medicare allows them to have, almost $8,000. And then guess what? Resets January 1. So that's what? Almost $16,000 out of pocket you can have. And that's only for the things that were approved. So if you're looking for a Medicare Advantage plan, please, please look further than the premium and the give back and the pharmacy card. Look at worst case scenario. What's going to happen if I have freaking cancer? What's going to happen if I have to take a Part B drug? Okay. The Aduhelm or Aduhelm or however they pronounce it, the new drug that they just use as justification to improve everybody's Part B premium up 14.5%. They're using this one drug. That's a Part B drug administered under Part B of Medicare. On Medicare Advantage plans, you'll see Part B drugs, you pay 20%. That drug is $50,000 per person per year. $50,000 per person per year. So do you think you'll hit your max out of pocket if you're given that drug, if it's approved by Medicare, which it will be, I'm sure of it, even though the research on it is just freaking nuts. I forgot to get that video for you. I'll get it. I do have the story, though. Let's see. DR says, I will retire next year. I'm in California. A Medigap rate sheet shows the lowest cost plan in available to me is with State Farm. Are some companies' plans not available through agents like yourself? Yes, that's correct. There's a bunch of them out there. USAA. There's some plans that are not available through agents. They have direct-to-consumer plans. Transamerica has now a direct-to-consumer plan that's different than the one that we could offer as agents. And then they canceled the plan with all us independent brokers so they could go direct-to-consumer. But however, let me address two things. One, the Medigap rate sheet that you're looking at, you shouldn't be doing it by yourself anyway. And if you're getting your rate sheets from the state, they're probably inaccurate. We have a quote engine that costs us, I think, $2,300 a month, where we can see all companies, whether we're contracted with them or not, whether we can sell them or not. We can see everybody out there, and we can see their rate increases and the impact that it's had on people in the past. And we can make a recommendation based on what's the large risk pool, how many people do they have insured, how many covered lives in the United States. Some things that are more important factors than what's the AM Best rating for Medicare supplement plan really doesn't matter, because you've got reinsurance, you've got the state guarantee fund, you've got a whole bunch of coverage for that, and the claims as a whole are not that high, and they have reinsurance for high claims. The most important factors are not just the premium, the monthly premium, certainly if you're turning 65, because most of these companies will have two different rate bands, one for getting people lured in at the age of 65, and then one for everybody else. So if you have an inexperienced person, brand new agent, somebody just trying to, gather business from people as quick as possible, only focused on one thing, and that is, what is your price when you're turning 65? As if that's going to be the indication of what your experience in a lifetime with Medicare is going to be. That is one of the worst things you can possibly look at. You need to look at the longevity of the company, how they've factored in the differences in the rates, like Plan N. You mentioned Plan N. Yes, Plan N is great. You can probably saw that at plannmedicare.org. Is it the best thing for California? Maybe not. Why? California is unique. It has the birthday rule. If you have Plan N in California, and by the way, a recent video on YouTube was wrong where it said the birthday rule in California is 30 days before your birthday and 30 days after. That was changed, and I put that out to all my agents in June of last year, when it was changed by California to be 30 days before and 60 days after. Matter of fact, the Department of Insurance website had it wrong 3 months after the bill went into effect. And I wrote to the insurance commissioner, and she thanked me very much for correcting her on the website. However, I digress. The Medicare birthday rule in California says you can go from a same to same plan on your birthday, no underwriting needed. Awesome. You can go the same to a lesser plan from F to G, from G to N, no problem, no underwriting needed. However, if you're on a Plan N, and for some reason you get some kind of sickness, and you're going to not want any copays, and you want everything covered, you want to go to a Plan G, which is very much highly compressed in California. It's a long story, but it's much more competitive to have a Plan G in California than it is almost anywhere else. So we might, in fact, recommend a Plan G in California where we wouldn't in Colorado, Utah, Arizona. It's because it's unique to that area. And yes, while I'm in Charleston, South Carolina, we have thousands of clients in California, and we know that market. We know the carriers. Would I put you with State Farm? No, not even if I had it, for a variety of reasons that I can't go into here for someone to think I'm disparaging a company. It's based on experience. I wouldn't put you with a Plan N with State Farm. We need to look at Plan G, first of all, to give you the variety of options, especially given your health history, which we should go into, just to make sure that you have all the options in the future. And you shouldn't be looking at a Medigap rate sheet. We can show you all the sheets you want to look at, but with real, up-to-date, up-to-the-minute rates that we know are 100% accurate. Gosh, I get on a soapbox. Thank you. I love it when RNs opine. Daniel said, I cannot afford a supplement plan, so I opted for Advantage. There's so many questions in there that I would love to go through with you if we had time. And you can look at those options still from January to March 31st during the disenrollment period. I encourage you to get with our agents and look at the market. If you yourself have looked through just the rate sheets out there and you didn't see all the plans that are possibly available, maybe some new plans came to the market, maybe there's a plan letter that you did not give full consideration to because you didn't understand it, let a licensed professional who costs you nothing look at those options before you completely give up and turn your life over to a managed care plan. I just encourage you to do that. And if an Advantage plan is best for you, again, get some professional eyes on that so you can make sure you're in the best plan. You can switch plans or disenroll from a plan from January to March. I encourage you to let us look at that for you. My supplement is $74 a month. Rock on. Hi, Christopher. I'm a client of yours. I'm having problems with my Medicare billing. I just started Social Security in December, started Medicare in November, and they're billing my Social Security 4 months. There's a reason for that. I mentioned earlier that if you have Social Security income coming in, they should be drafting your premium for Part B out of your Social Security. Many people are very smart and they're deferring the start of their Social Security income. Very smart. You get, what is it, 7 or 8% per year combined added to what will be your future benefit from Social Security, assuming that it stays intact. That said, you have to set up billing for your Social Security premiums. If you don't, they're just going to send you something in the mail, which may get lost nowadays. It may get there way too late and you might lose your Part B. It happens so many times now. I would highly encourage you to go to mymedicare.gov and sign up for monthly bank draft with your checking account so that there's no interruption in your Part B premium payment. You can do that at mymedicare.gov. Sign up for an account. On that account, you can see all the things that Medicare is paying for you. You can see what your drug plan is. You can see what your supplement is that Medicare has on file for you. You can make sure it's all correct. But more importantly, get on the monthly bank draft for your Social Security premium payments. Otherwise, by default, they're going to charge you quarterly things, and they're just going to send you a statement in the mail that you may miss. And then you might put a check in the mail, which I can tell you from my investigator days at the sheriff's office, worst possible thing you can do is put a check in the mail. So many people can interrupt that check, look at it, take it out of there, bleach your information off of it, and get access to your bank account. Direct deposit, direct withdrawal is the safest way to transact money today. It's safe. You're protected by your bank and everything else. So go to mymedicare.gov, sign up for monthly bill payments. Also, if you want to pay this one particular payment, at mymedicare.gov, you can pay one payment, like for your quarter, using a credit card and get credit card points for it. You can't use that every month as a bank draft. You have to use a checking account. But for a one-off payment, you can use your credit card and then sign up for the monthly bank drafts. I ain't doing it. Went from a supplement to an Advantage for 21. Want to go back to a supplement. I left a message last week, haven't heard back. Only have until tomorrow if I want to switch back without underwriting, I think. Okay. I'm sorry we waited till last week, but we're doing everything we can up in here, and you'd have to go through underwriting first. There's no time for that. As I mentioned at the very beginning, if you're on an Advantage plan, if you're in a trial right, you probably need to find, I think I do remember that message. You wanted Blue Cross in Texas. It just came back to me. If you want Blue Cross in Texas for a Plan G, which is what you wrote me about the other day, and I wrote back and said, call Blue Cross in Texas and see if they can work with you right now, because your limited time frame was you wanted to exercise trial right, get off of Medicare Advantage within the first 12 months and go to one specific plan. Call that one specific plan and sign up with them. They don't pay us agents to administer trial right applications. So I don't think any agents will be beating down a path to your door to help you with a trial right guarantee issue application when they pay us absolutely nothing to do that. And we have to prioritize the people who are our existing clients that reach out to us at the last minute in AEP. So if that was you and you were asking me about Plan G in Texas with one particular company, I would encourage you to call that company and tell them what your situation is. I was told 104 for Plan N, and that's in response to the RN lady saying she had 74. Back up and tell you how Medicare supplement rates are created based on your zip code, your age, all the people that are in that area, and what the Medicare reimbursements are, and what the premiums are and what the experience of the carriers are. If you're in a state like Virginia, you're going to pay next to nothing for a Plan N. If you're in Florida, you're going to pay a fortune for Plan N. If you're in New York, you'll pay 2 fortunes for Plan N. All depends on your zip code, whether you use tobacco or not, your age, and everybody else that's in your risk pool and which plan you've selected. So you can't compare apples to oranges. I've got 1 through 103. Yes, indeed. But they're all different. Everyone's unique. God made them that way. Hi, Christopher. If I get Medicare A, B, D, Medigap, and dental when I turn 65, I'm good to go. No concern or any penalties. Exactly correct. No penalties. We always encourage everybody to look at their drug plan during this time of year, no matter when you turn 65. If it was, October and we helped you with a drug plan, that drug plan for 2021 would run out at the end of December, and then they auto enroll you into whatever they want for the next year. There have been so many changes with plans, especially WellCare, old Aetna Legacy Part D drug plans being consolidated this year into less plans that people who had benefits with those companies in prior years on their drug plans may be shocked to see if they did not follow our advice and what we sent to our clients months ago. They'll be shocked to see all the changes that have happened in their drug plan when they actually go to use it in January. Best advice is, if you've not yet compared drug plans for yourself for next year, no matter when you signed up for it, please go to startpartd.com, put your drugs in, and compare the companies based on the total out-of-pocket cost. Little tip here, if you used to use CVS Pharmacy, try changing that around, putting in Walgreens, try Walmart, see what the big differences are or may be with your drug plan options for 2022, because some people are in for a really big shock. And I'll be playing this video back saying, I told you so. We sent it to our clients October 15th, October 18th, November 3rd, and every time I've interacted with anybody in the last week saying, here's where we mentioned this, please make sure you review your drug plan. Let's see. I have a phone appointment for A and B on January 19th. Phone appointment. Can I still qualify for N and C without paying out-of-pocket expenses? I don't have enough information there. You have a phone appointment with who? With Medicare, with Social Security, and talking about starting Part B, still qualify. If you've not yet started on Part B, then you can qualify for anything on Medicare Supplement for 6 months out, anything on Medicare Advantage for 3 months out. So that's, if you're new to Medicare in any way, shape, or form, then you don't have to do anything by 12/7. Yep, somebody's answering somebody else's question. I turned 65 in September, got my Medicare card, and I need a supplement plan and Plan D. That's Part D. Let me go to the link that's best for that, and that is on 20. Let me get there. I'll show you right here. If you'll go to seniorsavingsnetwork.org/open enrollment, seniorsavingsnetwork.org/open enrollment, please book a time on our calendar. Very easy to do that. This will round robin put you in with our top agents that handle brand new to Medicare people, and they go through every part of that for you. You will need a drug plan before January if you don't have one right now. So you need to do your drug plan before we'll have a chance to get you on our calendar. We have no more slots available for going over drug plans. So you need to go to startpartd.com and get your drug plan for January right now. We can't do that for you. There's just not enough time at this late stage. So if I were you, I would go get your drug plan for next year. That walks right through it. There's a video walking through the whole process. But for the supplement, please go to seniorsavingsnetwork.org/open enrollment. You'll skip any health questions because you don't have any, and we can get you right on the calendar and get you signed up. You have to be patient. I live in Nevada and we'll be staying with Senior Savings Network. Thank you so much, LC. Yes, this is the craziest time of the year for sure. Thank you for that. Let's see. Your mom's birthday is also Pearl Harbor Day, Elsie. That's awesome. Congrats, she's 91. That is great. Let's see here. Do I have a video on the negatives of Plan G high deductible? No, I try not to be negative in my videos. Just educational. I got Medicare A, B, and D and Medigap when I turned 65 2 years ago, then decided not to retire. Hopefully with an employer plan of 20 employees or more. I still work full-time with benefits. Any way I can get a reduced rate for not using my Medicare yet? No, I wish. I love it. Every time I'm in a restaurant, my mom will say, do you have a rate for seniors over 55? And no, there's no discount for Medicare for not having used it up to that point. Good try, though. That's a good point. Please confirm that I need to do nothing if my current Part D drug plan is available next year and I want to continue on it. Yes, but I'll reiterate, make sure that you know the benefits from next year are acceptable to you, because many, many plans are a changing. We had this situation last year with one of the companies I won't mention. Everybody was paying like $13, $14 a month. They were very happy with that. They dropped one of the biggest drugs that people were going to that plan for. It was Eliquis. I'll mention it to you now. And then the drug plan itself, the premium for those people who just rolled over went to like $65 a month. And they're like, wait a minute, that drug's not covered and my premium just jumped up. You don't want that kind of surprise. So I encourage you, that website can handle thousands of people at one time and it doesn't cost anything. Just look at your drugs and your pharmacy and how it's going to compare next year. And yes, by all means, if it still says that the current plan that you have is by far the best, then just roll with it. You don't have to do anything as long as you're keeping the same plan. Absolutely. Let's see. I want to continue with currently 3. If I want to continue with the Part A and Part B and D I currently have, do I need to re-enroll or will my coverage roll over? Everything will roll over, but as I just mentioned, the drug plans, many of them are changing. So you should look at it again. If you're fired over 65, working and have insurance, is there a penalty if you're fired and I try to get Part B? No, not at all. They don't care if you were fired or if you left voluntarily. The point is you're having a change in your life circumstance. If you go to howtostartmedicare.com, right there, howtostartmedicare.com, you'll see the form that you need to have employer proof that you had qualifying coverage. If your employer won't give you that proof, because you might have a relationship issue right now, there are still other ways based on experience that you can satisfy the proof requirement. Those means can be a deduction on your paycheck for where you paid your health insurance premium at the workplace. It can be your ID card, especially if you've had ID cards that you've kept over the years. It can be your benefits booklet. It can be an explanation of benefits that you got from your workplace insurance. Anything that you can get that proves that you had prior coverage, you should be fine to start Part B. Is your phone number on your website? Yes, but our phones are all jammed right now. We have many contact forms that you can securely put your information there and tell us exactly what your situation is. But yes, our phone number is at the top of all of our stuff. I can put it there. No, it's right there too. 800-729-9590. COBRA works as a supplement to Medicare, not in place of it. Supplement to Medicare. COBRA is definitely, not a replacement for Medicare for sure. Look at that. We called you moments ago. Hallelujah. We have a big crew of people working as hard as they can right there. My birthday's tomorrow too. That's awesome. Sandy said, I passed your question right by. Sandy, I did not mean to pass your question right by. I have 100 on here. I'll go back and see if I can see it. There it is. I need a Plan B program that will work with Pennsylvania PaceNet. Can you help with that? I don't know about Pennsylvania's PaceNet. So I can't answer that question. Works with Pennsylvania PaceNet. I'd have to look into that. Can't answer that question right now. If you know what those plans are, be happy to answer that. Let's see. If you have a question, you've not yet put your question in, please put it in the live chat right there. Be happy to try to get to them. Can't get to all of them, I'm sure. Just signing up for a drug plan, kick me off of Advantage now or when my supplement takes effect. Anything you do with regard to a drug plan or any enrollment that you do for Medicare Advantage always takes effect on the 1st of the next month. So yes, if you sign up for a drug plan on December 7th at midnight, which is not too late, that is the end of the period. Some people have said, I have an appointment with your office on 12/7. That's too late. I'm scared about that. You don't have to be. it doesn't matter during AEP if you submitted your application on December 7th at 11:50 or December 1st or November 29th. So to answer your question, yes, now's the time, because anything you do right now in your situation will take effect on January 1. So if you sign up for a drug plan now, it's going to start on the 1st of the next month. Similar to the open enrollment period, the disenrollment period for next month. If you do any changes during that period of time, I've got that slide right here. If you drop your Advantage plan during the first quarter of next year, if you want to go back to original Medicare, if you start a drug plan during that period of time, and you can only do the drug plan if you've dropped an Advantage plan, anything you do in January kicks in February 1. Anything you do in February kicks in March 1, no matter if even it's the last day of the month. That's how Medicare works with their plans. Let's see. I canceled my mother's Medicare Advantage plan, not knowing it canceled out her Part D prescription drug plan too. That's because it was an MAPD, Medicare Advantage and Part D. It's the all-in-one plan. They just sandwich everything together without the benefit of a drug plan specifically best for you. It's just one packaged in the plan. So I canceled out my mother's Medicare Advantage plan, not knowing that it also took the drug plan with it. She wants to get her medication, and it was $570. I called and reinstated her Part D. Can I do anything? You can't do anything for the time in which she did not have coverage. The good thing is that you got her on a Part D plan for January if you did it by December 7th. Hopefully she's also on a supplement plan, not subject to 80% of all Part B charges, not having any insurance whatsoever. Let's see. Fantastic. We'll call after tomorrow on an Advantage plan and want to go to plan. That's a Plan G in Colorado, but had cancer. Dang. It depends on when you had cancer. Most of the carriers are either 3 or 5 years on a look back with underwriting. So hopefully that time frame works and we can do something there. Delta Tango DT said, I turned 65 this year and am retiring next year. I have a stack of junk mail, literally 6 inches high. Oh, I'm certain of it. Having to do with Medicare. Should have just throw them all in the trash. Absolutely. Or if you're a kind, one of our friend clients out there, put them all in a big package and send them to me. I love to review those things. They're a lot of fun. A lot of our local clients will bring them into me, just a huge pile of them. And we go through what people are promising and which ones are even legal and compliant with what they're putting out there. Delta, Medicare isn't just writing you because they're lonely. That's funny. Passing Through says, currently on an Advantage plan, who do I call today to go back to A and B plus a pharmaceutical? I don't know. I don't know who. Well, actually, if you just want to go back without a supplement, you just go sign up for a drug plan. That's simple. You sign up for a drug plan, it kicks you off the Advantage plan. Again, the challenge is if you have no insurance whatsoever, there's no limit on your out-of-pocket cost for all the years in the future. And if you don't find out at least if you can get a Medicare supplement through underwriting, it could be very potentially damaging to a bank account to have an unlimited, infinite amount of bills that are assessed to you. Not only the $1,500 to go into the hospital under Part A deductible, but all the costs under Part B. Chemotherapy, outpatient, rehab, everything's under Part B these days. Even the most expensive drugs, chemotherapy drugs and osteoporosis drugs, they're all administered under Part B. So having no backup, no protection whatsoever is not a good idea. What I would recommend is get on our calendar through the underwritten link, which I can send you. And let's look and see what you might qualify for. And we can do that during the next period of time. If you go to the seniorsavingsnetwork.org/underwritten, and just see if you qualify for a supplement. If so, we can help you with that during the next quarter. But you don't have to drop that plan right now. You can let it ride into January and use that next period of time so that you can review those options. But if you want to drop it right now, just know that we're kind of flying without a net there, without any insurance whatsoever. But to answer your question, to trigger your off of Medicare Advantage program, just sign up for a drug plan. It automatically kicks the other one out. Bill said, Delta Tango, I got my supplement off of Chris, and every year I make a big bonfire out of it, all that junk mail. Amen. And let's see here. The junk mail is most likely for Medicare Advantage plan. Yeah, you're absolutely right. That's where they make the most money. So the question is, I delayed my Part B because it cost too much, but I need coverage. I just recently got approved for Medicaid. Can I apply for Part B now? Depends on what your age is. Or do I have to apply in January for July? It depends on what your age is. If you did not do Part B and you're over 65, you can apply in January for a July 1 start date. That's using the general enrollment period for Part B. Generally not a good place to be because they'll charge you a 10% for life penalty for every full 12-month period. Now, if you just delayed it for 3 months, 6 months, 9 months, you're okay. But we're looking at July when it starts. So any period from July of 2021 going backwards that you did not have Part B, it's going to be a 10% per year penalty added on top of what the premium already is, which just went up to $170 for 2022. By the way, interesting story on that that I wanted to cover. Let me show you this right here. This is very, very interesting to me, and that there's been a development on, I was the first one on YouTube to talk about the change in the Part B premium and how shocking it was and how horrible it was. Well, there's been a change. Many, 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 many people wrote to me saying, leave Republicans, leave Democrats out of it. There's nothing that this administration could have done. This is merely the numbers in play. And there's nothing the administration could have done. I said, bull. The administration runs CMS, the Center for Medicare and Medicaid Services, which made a decision based on an unapproved drug to pass the worst case scenario impact of this drug that's not even approved yet, that's barely squeaked through FDA approval under very clouded circumstances that are now under investigation from the Office of Inspector General. All that weird, murky stuff going on. And yet they're going to say that due to that, CMS made a decision, a preeminent decision based on no actuarial data whatsoever. Let's just pass on a huge Part B cost price increase to everybody on Medicare. It's absolutely stupid. Should never have happened. So guess who stepped up to ask the administration about this? Bernie freaking Sanders. Bernie Sanders asks Biden to prevent the Medicare premium hike tied to pricey Alzheimer's drug. Bernie Sanders. That's amazing. In a letter to the White House on Friday, Vermont Senator Bernie Sanders asked President Joe Biden to stop. Now, how could he ask him if he had no ability to stop in the first place? Because he can. Absolutely. In a letter to the White House, I think I was the only one that said that. Vermont Senator Bernie Sanders asked President Joe Biden to stop a Medicare premium increase he called an outrageous increase attributed to the Alzheimer's drug Aduhelm, is how they're pronouncing it. The biotech company Biogen, which was just about to go bankrupt, which just lost, by the way, the person who invented the drug. He just resigned under cloudy circumstances based on its approval with the FDA, which is under investigation, but I digress. Biogen's $56,000 price. You know how much they've sold to Biogen since it got approved by the FDA? $300,000 worth of the drug. But wait, how many people could be taking it if they've only earned $300,000 on the drug since it was approved in July last year? This year, I believe it was. Ridiculous. Something weird is going on, folks. I'm just telling you. So Biogen's $56,000 price is the poster child for how dysfunctional our prescription drug pricing system has become, Sanders wrote to Biden. The notion that one pharmaceutical company can raise the price of one drug so much that it could negatively impact 57 million senior citizens and the future of Medicare is beyond absurd, said Chris Westfall. No, Bernie Sanders said it. Holy mackerel. It ain't just me. With Democrats in control of the White House, the House, and the Senate, we cannot let this happen. Oh, but you did, Bernie. If Biden agrees to Sanders' request, the scheduled January increase of $21.60 per month to Medicare's Part B premium for outpatient care would decrease to around $10. Well, anything is better than nothing with people with a fixed income. This would make the monthly premium for 22 around $159, much better than $170. The planned increase in the Medicare premium is the biggest ever in dollars. The Medicare trustees report had estimated a $10 increase from the current cost, which everybody else on YouTube told you was going to be the final number, and I knew something was amiss. It just didn't sound right. So I waited to the right number to finally tell you. Go back and look at all the YouTube videos from the others that said it's going to be 117 or what does it say? 157, whatever they thought it was going to be. They just went off the trustees report. That's just a recommendation. The executive branch can override that, which they did to the detriment of seniors. The higher rate is so Medicare will have a reserve. Have you ever known of Medicare to have a reserve? The trust fund, by the way, is a figment of their imagination. It never did exist. There's no trust fund for Medicare. So the higher rate, CMS said in their report, or in their letter that they released on a Friday night, by the way, document dump, said that they'll have a reserve prepared if the program formally grants coverage for the drug. The FDA controversially, you could say that again, granted approval for the drug, the first medication for Alzheimer's in 2 decades, during the summer, despite outside advisors' recommendation deeming that the drug would slow dementia through reducing plaque clumps in the brain. Most experts say that the drug has not been clearly demonstrated. That's the truth. The Veterans Administration declined to list the medicine on its roster of approved drugs. Wonder why? Medicare has begun formal assessment to determine whether it should cover the drug. Well, how then do you, and I'll get back to the questions, I promise. How do you start charging 57 million seniors for something that you haven't even approved? It just makes no sense. Sanders' letter comes as Democrats have had to step back from their dream of delivering dental and vision coverage to Medicare's recipients as part of Biden's sweeping social agenda legislation. They've also had to narrow the scope of price negotiations with drug companies, although coverage for hearing aids stayed in the bill. Even if the legislation passes, its benefits will phase in over time. It would not be available right away, but the premium hike would hit right after the new year. Yeah, they'll take it from you right now. Sanders wrote, and Westfall First said, it could not come at a worse time for older Americans all over this country who are struggling economically due to the inflation that they've brought. I'm sorry, I added that. Sanders asked Biden to order Medicare to hold off on approving coverage for Aduhelm until there is scientific consensus about its benefits. Amazing. Biogen defended its pricing, saying that it looked carefully at cost of advanced medications to treat cancer and other conditions and just thought that they'd just throw this in there. A nonprofit think tank focused on drug pricing pegged the actual value at between $3,000 and $8,000 per year, not $56,000, based on its unproven benefits. Woo! So that's what's new in the Part B premium. It might not actually be as bad as this administration wants it to be by just passing on something to you that's fictitious, not proven, and doesn't even exist as an approved drug yet. Whoa, boy, I tell you what. Somebody better start thinking about how to protect seniors rather than just passing on things to them that have no business for them paying for. Okay, let's go to more here. Let's see if I can take this away there and go to the questions. People are answering people's questions in the chat. I love that. My husband chose Medicare Advantage HMO. He's having knee replacement in February. He said they told him he could only have 1 day in the hospital, then come home to my care. I'm scared I can't care for him. Yeah, and the 1 day in the hospital is the day of the procedure. They're going to try to do that as outpatient. One of the challenges, and I'll say challenges because I think it's worse than that, but I'm trying to be respectful. One of the biggest problems that we have with people that have insisted and we put them on Medicare Advantage is getting at-home care paid for. The second biggest thing is getting recovery care. They have to go into a skilled nursing facility for rehab after a broken back, broken leg, pin in their leg, that kind of thing. Going into skilled care afterward with Medicare Advantage is sometimes like pulling teeth on an elephant that's chasing you with tusks. It is so difficult to get those skilled nursing things approved and then get you in there for enough days that your doctors say that you really need for care. And then finding one that's in the network. Like here, I was looking at an HMO here in Charleston. The nearest skilled nursing facility for one of the local HMOs here is in Columbia. It's like an 1.5-hour drive away. And yet if a senior is on that Medicare Advantage plan here in Charleston County, and they have to go to that skilled nursing facility an 1.5 hours away, how are their family and friends going to come visit them? The restrictions and the limitations are something that people just really need to know up front. I'll keep in our prayers, Bex. I hope it goes smoothly there. I was told that I have until July to get Part D since I turn 65 next year. That's right. You sure do. And again, since you're having an event that happens in your life in 2022, 12/7 means absolutely nothing to you. Does not matter. Triggered on when your life change after 12/7 happens. Let's see. I'm sure I'm not the only one who would appreciate a video on the California specific issues regarding Plan G and Plan N, if you have time for such a thing. DR, let me share something with you that I struggle with on a daily basis. Sometimes with having had 4 million views on YouTube, I'll put something out and then I'll just see what the competition does. And they put out something that's exact copycat, and they'll start to adopt their recommendations and their behaviors based on what we've been doing successfully for people here behind the scenes when they call us for exclusive help. I try to balance the fact that I want to help the entire public with as much experience that I've had so they can just go do their own thing. But sometimes there are things that we discover in the marketplace that we have to hold to the people who are kind enough to let us help them through the process. Otherwise, there would be no competitive advantage. Otherwise, there would be no distinction in going to us who, I tell you, I search the news, scour the news every single day for any advantage that we can get to our clients. And when we communicate to them our private meeting, that we have a sales meeting of our entire office, not sales, it's our entire office, every Monday. And we go over the new changes and how they can benefit and how we can implement changes to help our clients. If we just put all of that on blast and put it all out there in the public, then we have no distinction between what we can offer our clients and what everybody else can. Because there are thousands of agents too that subscribe to our material. And many times they'll use our research and put it in their own words. I've got video after video I could show you of them copying what I'm putting out there word for word for word. And sometimes it's just frustrating. So if you want the benefit of the best possible advice with the up-to-date information, it may not be in this stale video that, depending on when you're watching it, is a year from now rather than the live stream. You should really deal with somebody who's actually writing insurance every day, actually in the game, and actually has experience on it, from California to Ohio to Virginia to Florida to everywhere in between. And sometimes you get what you pay for. If you try to do it yourself based on a rate sheet, you don't get that kind of experience. If you go to somebody who just started yesterday, you don't get that kind of experience. If you go to somebody who copied a video that I put out 3 days later with their own spin on the same facts that I already put out, you're not going to get that same kind of experience. Yeah, I'd love to do a video on everything we do behind the scenes and every piece of advice we give everybody all the time, but I can't do that. Let's see. So many things. Somebody put in there, is that true? There's no context there. T-Bone. I'm in Florida, DT, and got Plan N from United of Omaha. That's a Mutual of Omaha brand for Florida. And it's $140 a month. Yep, that's about accurate. Depending on, like, if you're in South Florida, the rates are much, much higher across the board, regardless of carrier, than they are like in the Panhandle, which is basically, Alabama or Georgia. So depending on where you are, zip code makes a big drastic difference. In Florida, he's talking about Plan N there. So Plan N, there's a distinction there. You saw before, our nice RN friend had it for $74 a month on Plan N. This is $140 a month. Same plan, same benefits, because the Medicare supplement plans are exactly the same. If I tell you I've got a Plan N in Florida, it's the same one in Virginia. Same exact plan. You don't have to worry about it. There's no network, no restrictions, nothing. The difference is the price you're going to pay based on where you live in the zip code. Can you move? Yes, you absolutely can. Let's see. Delta Tango said, I just signed up for insurance at work for 2020, so I'm a bit confused about what to do from here, and if anything, to ensure that I don't lose any benefits in the future. You can reach out to us. We can help you. If you're 65, approaching 65, or over 65, you have a lot of options, and we can walk through those. But again, it's going to be unique to your situation. How many drugs do you take? How often do you go to the doctor? What's your deductible at work? What are your co-payments at work? What does your network restriction plan look like at work versus what's available on Medicare Advantage near you? What is available on Medicare Supplement near you? Everybody's different. So you can't put out a video that says, absolutely, Plan G is the best. Leave your employer plan. Absolutely. Every time, every case, which I've seen agents do. You can't do that because every unique situation requires a unique prescription. But we'd be happy to do that with you. I'm currently on Medicare Advantage in California is somehow connected to my past employer. Yep, that's happening a lot. I'm a retired state worker. Would you recommend I check with someone like you to assess my coverage? Yes, and you have 2 periods. One ends December 7th. You can't get an underwriting decision by then, and you need that even in California with the birthday rule, because the birthday rule, remind you, in California only applies and protects you if you already have a Medicare supplement. You can go from like to like and like to less. It doesn't protect you if you're on a Medicare Advantage plan. And yes, many of the employers out there have given up their what do they call them? Their promised benefits, that we're going to take care of you in retirement. We're going to keep all your health insurance during retirement. The city of New York is the biggest recent example of that. And also Nashville, Tennessee. They said, oh, sorry, we changed our mind. We're going to a Medicare Advantage plan. And we're going to subsidize it to some extent in the early years and make it look really attractive. But in the future years, once you're off of the supplement, once you're off of our regular health insurance, we're going to have to go ahead and go to market rates with that, which means you might as well be on original Medicare Advantage. Original, there's no such thing. You might as well be on a commercially available, publicly available Medicare Advantage versus the retiree Medicare Advantage program. But yeah, you should definitely look at those, and that's going to be unique to your specific plan. And we have the whole option to do that in the first quarter of next year. I'm learning so much, especially not doing this alone. Amen. There's no reason to. Oh, here's a funny one that you'll appreciate. HowDoYouGetPaid.com. Check that out. HowDoYouGetPaid.com. If you're wondering how I make out in all this, HowDoYouGetPaid.com. Just write it down on a scratch pad. It goes to answer the question of how insurance agents get paid. And that's why it doesn't cost you anything, whether we put you on this plan with that company, this plan with that company, or that plan in that state. Doesn't matter. We don't charge you anything for our help. We just give you independent advice, not working for any one insurance company. I'm 57, and I've been disabled on SSDI and straight Medicare since the age of 26. God bless you. Which is best for California? Let me look. I've got a website called MedicareOnDisability.com. MedicareOnDisability.com. Oops, that's the wrong button. If you go to MedicareOnDisability.com, we list on there for people, and that was a purple shot. I have no idea why that video was that messed up. But MedicareOnDisability.com is where, if you're on Medicare under the age of 65, it will basically show you the states that we can help you in and the states that we can't help you in. And I list them here. Now, in some states like New Jersey, they only offer Plan C, and that's not a misnomer. It's literally a Medicare Supplement Plan C if you're under age 65. Most agents won't even know that. They'll go in the quote engine looking for Plan G and Plan N. They're not there. I guess there's nothing available in New Jersey. No, there is, but based on their goofy law, it's only Plan C that's available in New Jersey. People in Pennsylvania will be shocked to know that you're paying the same rate as like a 65-year-old. That's wonderful. However, in some states, you will find that the premium charged under the age of 65 is as if you're 95 years old. It's horrible. So like I mentioned at the very beginning of this, Medicare supplements are administered, regulated by the states. And some states just don't offer any protection for those people who are on Medicare due to disability. They're on Medicare under the age of 65. So we found that in certain states, we can help with a Medicare supplement in this situation. In California, yes, it's listed there. We can help you. And you can fill out this form right there on MedicareOnDisability.com. Fill out that form, and we'd be happy to help you. You don't have to do this by 12/7 in your case. I hope that helps. Hit the likes, guys. Thank you very much. Florida native. Yes, I'm a Florida native too. You know how rare that is to be a native Floridian? I was born in Vero Beach. My wife was born in Stuart, Florida. Let's see, a lot of comments on the political side that I'll leave out. Who do we protest this increase to? Well, like I said, this is a decision made to pass that on to seniors with a drug that's not even approved. A decision made by CMS. CMS is part of the executive branch. The executive branch is the president. So that is who has passed that on to seniors. Shoot me if you want to, but their own party told you that they're the ones that did this because they're the ones that can change it. A family member has retired Group Humana Teachers Association, State of Alabama. I'm afraid it's an Advantage plan. I'm worried about the details of recoverage. What can we do? We don't call anybody. I just have to tell you. You can give us somebody's name and phone number, but we can't call them. If you have them call us and there's a referral, we'll even send you a gift card to thank you for referring somebody to us. Make sure that they tell us that you referred them, but we cannot call anybody to solicit business. We have never, ever, ever done that. If you've ever gotten a call saying, I'm with Senior Savings Network and I'm calling to review your plan, it's a lie from the pit of hell. It's an agent trying to take our domain authority and our reputation and trying to scam you. I would love to know if you've gotten a call. As a matter of fact, this just happened last week. We have a sleazy agent out there, and I hate to share with you the behind the scenes stuff, but this just irks me when somebody's trying to use our name. We literally had an agent that is calling people and saying that I went out of business and I don't run my company anymore and I'm gone. And I guess the person mentioned that they're with Senior Savings Network, and they need to call them or let them do their business with them, sign up with a new plan. So I would beg of you, please, my faithful and loyal audience, anybody that's watching this, if you've received a call who said from somebody that says that we're no longer in business and you need to work with them now, please let me know who that person was. Please look at your caller ID and see what shows up on the caller ID and get their name so that we can pursue that person, because there's nothing worse than getting business through lying at people. It's just awful. Do you handle marketplace insurance? We don't, but we have a referral partner that does, and I'll put that on the screen now. At the top of the screen, it is seniorsavingsnetwork.org/under65. If you go there, it'll go to our referral partner for, in some states now, you can only use that state's marketplace plan. So that would not show up, but it'll tell you right there. And it's an independent brokerage that helps people under 65 that is reputable, that we've dealt with. Also for travel insurance, you can find that here. Always good idea if you're going overseas to have travel insurance on top of whatever health insurance that you have, because they can even pay to get you home. And then the dental plan coverage, and then dental vision hearing is where you can sign up for an appointment with us to go over it. So I'm going back through the questions. Some really positive comments. I really appreciate that, y'all, especially during this stressful time. Let's see. Dallas says, I'm the one who's been trying to get a hold of you. I need to get my Medicare back. Humana changed me over, and I just found out about it recently. I need to get this started before 12/7. We can't help you before 12/7. Every calendar spot for our finite number of people has been booked for the last week and a half. You can go from Medicare Advantage back to original Medicare. As I said, you can find out how that works from start to finish at our main website, seniorsavingsnetwork.org. And just look for the top where it says Medicare Help. And then the green button says Medicare Advantage to Medicare Supplement. Can go through all that with you. What about Oklahoma? Oklahoma is one of our biggest states. Love Oklahoma. And if you're talking about the under 65 thing, then my video on that page explains if the state is not listed in that list of states, what your option is in that video. It's right there. It goes through the entire thing on MedicareOnDisability.com. No advantage for the consumer. If you have many scripts and are sick, they have the advantage. Let's see. Wait, I'm under 65 on SSDI in Pennsylvania. Can I get C instead of G? If you're talking about Plan C Medicare Supplement, then probably, but not many carriers are selling Plan C anymore. They have to in New Jersey only because New Jersey has a goofy rule for under 65. But Plan C is not being sold much anymore across the country. But you can get any of the Medicare supplement plans that are available in Pennsylvania. If you're not brand new to Medicare, you do have to go through underwriting, and you can see the underwriting questions at this link, seniorsavingsnetwork.org/underwritten. So Pennsylvania is a great state if you're on disability and you're on Medicare due to disability in Pennsylvania. Yes, we can help with that. I'm from Georgia. Let's see. Been on disability since March of 16. Will turn 65. Yes. March 27, 2020. Is there anything I need to know about that? Yes. You are in open enrollment, my friend. So if I were you, first of all, This is a question most people don't know the answer to. If you are on Medicare due to disability at age 26, at age 50, or whatever, and you come up to Medicare at age 65 again, what happens to you? You get what they call IEP2, your initial enrollment period number 2, which means all the cards are on the table for you again without any evidence of insurability, no health questions. You can get your best drug plan, you can get your best Medicare supplement, and your rate, if you were paying more than you would anywhere else for being under 65 and being penalized like you are in Georgia, you can get the best Medicare supplement plan at the lowest possible rate at the age of 65. Definitely would love to help you with that. And congratulations for reaching age 65. That's wonderful. Little caveat that most agents don't know. Some of the insurance companies out there, when you're approaching this IEP2, they will not let you have a Medicare supplement that takes effect on the first of the month that you're turning 65. See, typically when you're coming to age 65, your Part B starts on the first of the month. So your supplement can start on the first of the month. Even though your birthday may be like December 7th, if I was new to Medicare and my Part B started in December because my birthday's in December 7th, I could start my supplement, I could start my drug plan, I could start everything for December 1st because that's when my Medicare typically starts. However, when you're already on Medicare due to disability, you're not starting on the first of the month. So technically you are 65 at the day that you're 65. And some of the Medicare supplement companies that are out there will not let you have open enrollment. They will not let you be treated as brand new to Medicare until you're literally your birthday, because technically that's accurate. You're not brand new to Part B on the first of the month since you've already been on Medicare. You're brand new to Part B on your IEP2 on your actual date of birth. Depends on the carrier that we select. We know all the carriers. We know what those rules are. Would love to help you with those options. Mr. Florida Native. Just go to seniorsavingsnetwork.org/open enrollment and get on that calendar. Again, we can look at and pick out a Medicare supplement plan up to 6 months before you're eligible for Medicare. And we can lock in a plan's rate today so that if they have a rate increase in the future, that won't impact you when the rate increase would have otherwise gone into effect because we lock in your rate. That's a good thing to do. 6 months before you turn 65 is when we can lock in those rates. Ronnie says, I'm new to Medicare. How long do I have to get a plan? It depends on which plan you're talking about. Medicare supplement, you have 6 months before you turn 65. New to Medicare, doesn't matter. Whatever you're starting Part B, okay? 6 months before that, you can lock in a supplement rate. You can do the application and everything. 6 months after that, you can also lock in a Medicare supplement without any underwriting whatsoever. Here's the challenge. If you're on Medicare Advantage, it's not a 12-month window. It is a 7-month window, and it's kind of goofy. 3 months before your birthday and your birthday. 3 months after your birthday. So we have this weird period of time where it's 5 months after your birthday. You can't get a Medicare Advantage plan even if you wanted to. 6 months after, can't get a Medicare Advantage plan, but you can get a supplement plan. It's kind of weird. We know all those dates. Love to go over that with you. Just book a time that's convenient for you at seniorsavingsnetwork.org/open enrollment. 6 months before you are ready for Medicare is when we can start looking at it and lock in a rate for you. Just confirm my Part D. I've already confirmed supplemental. Awesome. Fernandina Beach. That's a beautiful place. Yes, that is a gorgeous place. Wondering how being on Medicaid and having Part A and B classic Medicare policy will affect my ability to buy a supplement plan in whenever they determine I'm no longer eligible for Medicaid. That is a state-specific underwriting law. I'll tell you, one of the best companies in the industry for any agents that are watching, if you want to know what the state laws are specifically with regard to things just like this, like you're losing Medicaid or you're leaving an employer plan voluntarily versus involuntarily, does that trigger a special election period where you can get a guarantee issue Medicare supplement? The other one is, I'm new to Medicare, turning 65, but I smoke. Does the state law allow the company to charge me as a tobacco user or not if I'm in open enrollment? The company, the resource that I've found over the years that is best at answering all three of those questions, which are state-specific questions, is the Mutual of Omaha Underwriting Guide. Whether you end up going through Mutual of Omaha or not, that is a really good reference material, and they just updated it last month, by the way, of all those three different scenarios. So if you're wondering if losing Medicaid is a trigger or not, we can look in our guide and we can see, and it's all based on your state. In some states, that is an SEP for a Medicare supplement. In some states, it is not. Let's see. Repeating question, Chris. Wait, I'm under 65 in Pennsylvania. Can I get C instead of G? If you mean Plan C, yes, if it's available, but it's probably not. If you mean Part C, Medicare Advantage, yes, you can if you sign up for it before December 7th at midnight. You can see those options and watch the video at MedicareOnDisability.com. Let's see. Getting to the end here as the questions are fizzing out. If you have any questions before we leave, please go to the live chat over there and put them in. Otherwise, if you're watching this later, tell me your opinion on everything. Tell me your opinion on Medicare, on Part A, on Part B, on the premium, on the Part B increase, on the administration, what you think is right or not, on what Medicare should include or not. Put it all in the comments below on the video once the live stream is over. Would love to have all of your take on how this video was, how it could be better, what you hate about me, what you love about me. Love all the feedback possible. Please put it in the comments under the video once the live stream is over. But if you're on the live stream and you want to ask some questions, how many names could possibly show up there? That is ridiculous. Yeah, put it in the live chat over there, please. My husband turned 65 in June and signed up. Not sure if it's also Part B, but the bill is high. Bill from whom? They said based on income. We are very healthy and continue to work in our business. S Corps, which add in, I ran out of space there. If you started on Part B and your bill is very high, it's one of two things. One, you're not drawing Social Security yet. That would be my suspicion. And so if you're not drawing Social Security, again, they cannot withdraw your Social Security, your Medicare premium from a Social Security check because it's not there yet. If that's the case, no problem. They've already signed you up for quarterly billing. So you can go to mymedicare.gov, sign up for a monthly bank draft from your checking account. That'll solve that problem. It'll be monthly, it'll be automatic, and you can't lose it. And then again, you can make a one-time payment using a credit card. Again, that is mymedicare.gov. Everybody should have an account at mymedicare.gov so you can see what's going on with your Medicare. If that's not the case, if you're talking about not just a quarterly payment, but your actual premium is higher than it should be, that is known as IRMA. I did a video about IRMA. You can search my channel right here on YouTube for IRMA, IRMAA, Income-Related Medicare Adjustment Amount. That is based on the IRS feeding information to Social Security about your Medicare. These three organizations conspire to charge you more for your Medicare premium, both your Part B and your Part D, based on your income, how much you've earned. This amount changes every year, and it just changed for 2020. You can search medicare.gov for IRMA to see the current rates as they are available and applicable to you in future years past today. But on my video, I'll talk about some circumstances where you can appeal the IRMA determination and even get out of it if you fit that criteria. But that's what it might be also. It's either a quarterly payment that you're concerned about or the fact that they're adjusting your income based on 2 years ago, your total combined earnings, which is hopefully just a temporary adjustment and will go away. I have TRICARE. Do I need, when I turn 65, do I still have to pay the quarterly fee? I can't advise you on which one you have, or are you talking about Part B's fee? Not sure. How do we access the calendar? I looked on your site and don't see the option. Well, you have to know where to look, and I'm going to show them to you again. Right up here, right there. It depends on what. There's a different calendar for everything. We have a genius in our office that put together different teams of people who specialize in different things and their states. So when you go to our calendar and you say that you're underwritten and you pick your state, that state will drive your name and your information and show you the availability for that team of agents licensed in your state that specialize in your kind of thing, whether it's an underwritten case or open enrollment. Really, really cool. So there's not just one calendar for everything. It depends on what you're looking for. So we know how much time to allocate and which person of our staff to direct you to. We've got a lot of experts in different things here too. Let's see, I contacted one of your staff. Great. I turned 65 in June. When should I get all this started? I would do it in January. And in January, we can see all the Medicare supplements. We can see what the rates are, the availability, all the plans for next year. Everything will be available to us. I encourage you to go to SeniorSavingsNetwork.org/open enrollment. Book a day and time there for you that's convenient, and we will not miss that appointment. We'll have everything ready. I'm doing bank drafts for my premium since I'm not taking Social Security. Will they continue bank drafts after I start taking Social Security? That's a really good question. I think that they will. Yeah, you can opt to have it come out of your Social Security if you want to, but that's a function of switching over from, not taking the income to taking the income. And it actually is probably an option on that form. It's probably an option on that form when you're switching from, and I'm sorry I don't know that answer. Thank you for stumping me today. Let's see. Dallas, Chris, it's me, second call today. Where did you say I need to go to get my Medicare back? I've been on Medicare, I think 20 years. I had Humana as a supplement. All of a sudden they took Medicare away. Humana has two different sides to it. One is Advantage and one is supplement. So I'm not sure which one you're really talking about, because supplements don't go away. They never change. They never take them away. They never cancel them. As long as you pay the premium, supplements just don't go away. That's a very interesting caveat, difference between comparison and contrast. Medicare Advantage plans change every single year, and they can renew the contract or they can not renew the contract. They can change your doctors. They can change your benefits. They can change your max out of pocket. They can change your network, your drugs, your formula, everything they can change on Medicare Advantage plans, and they do often every single year. Medicare supplement, once you have one, it never changes. So I'm not sure if you're saying you had Humana as a supplement, maybe Advantage, I'm thinking. All of a sudden they took that away. That would be consistent that there was an Advantage plan that went away. If that's the case, then you want to go back to original Medicare. You can do that. Actually, that would trigger a guarantee issue period for you. And because you were eligible for Medicare before MACRA started January 1 of 2020, I don't want to get too much in the weeds here, but if they took away your Medicare Advantage plan, you have two options. And this does happen a lot. Happened last year more than this year. But if they take away your Advantage plan, you can either go back to original Medicare and get a Medicare supplement guarantee issue. And depending on when you were eligible for Medicare, it triggers whether or not, in your case, you were eligible for Plan F as your guarantee issue. That's the only one you can ever get as guarantee issue. If you're new to Medicare and this just happened to you, your guarantee issue go-to is Plan G. Neither of those are very good, really good solutions if you are having to get it through guarantee issue. My advice would be, depending on where you live, of course, and looking at your medical, talking about your medical history, how often you go to the doctor, we want to factor in if Plan N is worth applying for and going through underwriting, and your eligibility for Plan N based on how healthy you are or not healthy you are. Just a whole bunch of factors we should go through there. But I'm not sure what you mean there. If an Advantage plan and you got that taken away and you want another Advantage plan, you could call Medicare and they could sign you up with one. Medicare's phone number is 800, ready? 800-633-4227. That's 800-633-4227. Or you can use our Advantage plan enrollment thing if you want to do that. And that is called, did I not put it on there? Stinking rat. Medicare Advantage Near Me. Oh, I guess it's not on there today. MedicareAdvantageNearMe.com. There it is. You have till December 7th at midnight. Sorry, it just needs more of a in-depth interview to give you a specific answer. Will the popularity of different supplement plans affect their future viability and price? That's a great question. A lot of people have given the opinion that since Plan G is now the guarantee issue go-to for people who are eligible for Medicare on or after January 1, 2020, and more people are finding out and going to Plan N, does that mean that Plan N, because of its popularity, will suddenly go crazy out of whack? No. The good news is no. Ty Woolridge, the president of Aetna Senior Supplemental, mentioned on their advisory trip one year that they had been tracking. As a matter of fact, Mutual of Omaha mentioned this too, their claims experience, and that's the basis upon which they decide to impose a rate increase, and if so, how much, usually based just on trend and their experience, has been lower on Plan N because you can only get on Plan N one of two ways. Either you're brand new to Medicare and you're the healthiest you'll ever be, brand new Medicare baby at the age of 65, or you qualified for Plan N, by going through an underwriting screening process. And the differential is the people that are now flooding into Plan G, Medicare supplement, due to guarantee issue, is causing a tremendous adverse effect on those rates that are not just medical cost inflation and claims paid. It's Medicare cost inflation plus claims paid of people who they got stuck with that they could not underwrite. And that percentage every year is going to get bigger and bigger and bigger on Plan G. So having seen that in 2015, I put out the video called planinmedicare.org from 2015 to 2018. And then to 2020, when macro actually took effect, we followed those trends. And you can see that the line of deviation between Plan N rate increases and Plan G has gotten more and more drastic, as I predicted it would when macro was first passed in 2015. So no, you can have all the popular people in the world go to Plan N, as long as they get there through one of two mechanisms, either brand new to Medicare or through screening. You're always going to perform better than the plan who has to suffer under the regime of getting stuck with somebody, because that somebody, as I mentioned before, one of those things that triggers guarantee issue is losing your Medicare Advantage plan. So if you have the gentleman who's 76, 80 years old, losing his Medicare Advantage plan, guess which one he's stuck with? Plan F or Plan G. Those plans are stuck with the guarantee issue folks who might have a bad ticker, might have plenty of chronic ailments going on. That's always going to affect those plans. It's never going to affect Plan N. And then the other question is, well, when will Plan N become guarantee issue? It won't. They only have to have one. And it's just so ironic, so funny, that the one that they always pick for guarantee issue happens to be the one that they get the most profit from as the insurance carrier. I wonder how that ever happens. But if you want the one that's the most profit to the carrier and to the agent, get the Plan F or get the Plan G. Make a lot more profit from that than they do on the Plan N. Just being completely transparent with you. It's the truth. So if you've got an agent and they just pushed you on Plan G is great. That's why they call it G. It's the great plan. Get it. Simple. Okay. All right. Why didn't you tell me about Plan N? Why didn't you ask me how many times to go to the doctor? Why didn't you ask me what drugs I'm taking that may affect my propensity to use a Part B drug in the future? Those are questions that if you didn't get asked those questions and you just got shoved Plan G in your face, might leave you wondering, did I pick the best advisor for me or the best advisor for his commission? I'm just saying, these are just questions you should ask. I was told that if I had unresolved issues, I would wait for 2 years to go on Plan G. Is there any way to get help to buy food since there's no money left after 14/12? If I had unresolved issues, I would have to wait until 2 years. Kathleen, I don't know what that means, but if you'll reach out to us at that first link that's over my shoulder, underwritten, tell us what the issue is and we can talk about it. It sounds to me like you're talking about you wouldn't qualify for a plan, but whatever the condition is that you wouldn't qualify for based on has a waiting period of 2 years. And there are a lot of things like that. Aortic aneurysm, heart valve replacement. What's the other one? If you had atrial fibrillation and you had an ablation done, if you had cardioversion done and it was successful, all those kind of things are right at the 2 year mark. So I don't know what your exact scenario was where you couldn't qualify for a plan, but I know for a fact that we know what all those conditions are. If you'll tell us what those conditions are, we can give you a more accurate answer. Do you only help people who are new to Medicare? Wait, do you only help new people trying to get on Medicare? I just need to talk to you, Chris. No. Matter of fact, I got a funny call a year ago from an agent. There's one of our top producing agents who called me and said, I don't know what to do because I'm having clients call me now and they want me to review their plan with them. I'm like, yeah. He said, well, all I do is new to Medicare. I don't know how to underwrite a plan or find out what conditions trigger what on an underwritten plan. So for the first 10 years that I was in this business, all I did was try to reach people who are already on a Medicare supplement. And let me show you a couple of examples here. They're already on a Medicare supplement and they're paying too much, way too much for their supplement plan. And we continue to do that now. We take them from an expensive plan to a less expensive plan, from this bad plan to a good plan. I've always done business that way as the priority of what we do, because I, at the age of 5, wanted to be Superman. I found out that I can't grow up and be Superman because I'm not from Krypton. So then I wanted to put a gun and badge on and put all the bad guys in jail. Turned out that didn't really happen either. after doing law enforcement for that many years. So the best thing I can do to help people now is take them from a bad situation to a better situation. And I always used to be so happy telling my wife, I just saved somebody $100 today, $100 a month. I just saved somebody $50 today, put it back in their bank. Same benefits, different company, and put the money back in their pocket. So no, we don't just help people that are brand new to Medicare. I've made my whole career on helping people who are given the wrong advice, or they did it on their own, do-it-yourself thing. And by doing so, they got the wrong plan, or they stayed on the wrong plan for far too long. And it's a great feeling, I can tell you. And for the agents that are watching, it's a great feeling to go home and tell your spouse, I put thousands of dollars back in this person's household just simply because they took a chance on me helping them and they let me help them. So, yeah, we love doing that. No, we don't just work on the people that are brand new to Medicare. Do the people in your office know Medicare as well as you? Yes, and we're all learning every day. And we have constant trainings about that. I also train thousands of agents over on another website. It's a different business, but it's just putting out the information that we're putting out internally here. And that's called MedicareAgentTraining.com. Last I saw, there were 3,000 members from coast to coast. Many of the agents, the faces you've seen on the internet, are members of that website and have been for years, MedicareAgentTraining.com. We also teach at conferences and speak at events around the country. But the people who know Medicare just like I do the most are the people that are like Gabby right there in that picture in the other room. Unfortunately, sometimes they watch these live streams, but they can't today because they're just all too busy. I'm seeing from Nicole in the other room if there's anything going on. That's crazy. Wish I knew you were going to be live. Corinne, if you sign up for the subscription thing and you hit that notification bell, it'll notify you as soon as it knows that we're going to be live a couple of times. And I turned this on, I think, at midnight last night after I answered one of the last questions, and I scheduled it for today. It was not scheduled far in advance. I just wanted to try to help as many people as we could. And now I know the team is back in there picking up the mantle and calling people back and scheduling people and answering questions. Feel free, when this is over, you can replay it all the way to the beginning and see the questions. And they'll also be listed then in the description below. So you can see the question and click on it and jump right to that part of the video. You don't have to wait the whole time. Kathleen, while Medicare Advantage plans sound good, these young male licensed agents that continually put you on hold because they are new, I do not believe they care. Sorry to hear that. Okay, Dallas. Sorry, Chris. No, I didn't. I did sign up for a supplement when I was told to, and I went to Humana. They're telling me just to put my Medicare card away and use the Humana Advantage card. I want to. That's the problem, Dallas. You're not on a supplement, my friend. You're on an Advantage plan. And when somebody tells you to put your original red, white, and blue card, that card right there, somebody tells you to put that card away. That's the card that you've earned and worked your entire life to pay premiums into to get the benefits of. That's your original Medicare. And when you go to a Medicare Advantage plan, it's not a supplement. It is a replacement for Medicare. When they tell you to put your card away that you earned and instead use their card, you're not on original Medicare anymore. They'll tell you that you are. AHIP tries to tell people that they're on original Medicare. It'll pay for everything the same way that Medicare did. That's a lie. You're not. All of your health care is now determined by the private plan that you gave up that plan for. It's just so frustrating that they'll tell you that it's a supplement. Put your original Medicare card away. You got to play our rules, got to go through our networks, got to go through our pre-approval process, prior authorizations. You want to see some horror stories? Go to allaboutmedicareadvantage.com. And do we sell Medicare Advantage? Yes, we do. Only when it's the best thing and the last thing and the only thing that a person can get. But we're going to tell them with full disclosure the truth about all of it. Do I make more money with Medicare Advantage? Absolutely. Certainly do. Is it simpler? Yes. There's no premium. It's free. It's sometimes a scam. Sometimes. And yeah, I don't want to get in trouble. Let's see. So no, Dallas, you're not on a supplement because they would have never taken that away from you. You're on an Advantage plan and they can take that away from you every year. And that's one of the considerations for making your determination when you're new to Medicare. Do I want to give up my option for original Medicare and have a supplement and give that away for the private plan, which may never get me back to an original Medicare plan with a supplement? May never get back there. Can you go back to original Medicare and drop the Advantage plan? Yes. without a safety net whatsoever, not to be advised. I'd rather you have an Advantage plan than have nothing at all. But I'd really rather you know the full story. But too many agents out there are not telling the full story. They're telling the one side of the story that pays them the most and the simplest. Agents nowadays, the new generation, just sometimes can't say, well, you've got another option, but it's going to cost you money. Really? If you give a senior all the facts, you tell them the good, the bad, the ugly, one's going to be no cost to you, one's going to cost you a little bit of premium, but have the freedom and flexibility to handle your health condition in the future without a problem, without a limitation, without a restriction, without your doctor having to go, can I please get my person admitted to the hospital? I really want to fix their pain issue. You got two paths to go. And sometimes making that determination at the beginning is the most important thing you can do in your life. And many agents out there are just not telling people the truth. I'm eligible for Medicare. If I'm eligible for C or F, would one of those be better than N? It depends on your situation. Can't tell you like that. We'd have to talk you through your situation. I worked in a law office. It was easier than this. The good thing is you don't have to go get your insurance license. You don't have to remember every caveat to Medicare. All you have to remember is where to get help when you need it. Sometimes that's the most important thing, you know? You don't have to know everything. You just have to know where to get the answer for the stuff that you need to know. And that's what we do. Let's see. Had an ablation. Yep, that's what I thought. Gosh, called that one, huh? That's what it was. Yep, when it's been 2 years from that, please let me know. And you said you're scared. Please don't be scared. It's going to be okay. Yeah, we can help. Kathleen, I'm not going to put your full name up there since you're sharing that health info, but don't be scared. Don't be worried. We'll be here to help you as soon as we possibly can. Gabby was my agent. Oh, yeah? Well, Melanie was my agent. Love it. Chris, I have a supplement plan in. When I go to the doctor, I use my Medicare card and my supplement card. You use both the one time. Once they have you in the system as using your supplement and your Medicare card, put them away because you'll never need them again. The supplements are having their claims paid automatically, as I like to say, automatically, because the doctor will send the bill to Medicare. Medicare will reprice it with their magic and knock the bill way down. Then they'll send the balance, if any, to the supplement company automatically through a program called Crossover. You don't have to file claims. You don't have to get a paper form from the doctor and file it with anybody. Medicare supplements are just easy. Go to any doctor in the country that accepts original Medicare, and you'll find that it's most everybody. Dallas says, can you get me back to original Medicare? You can do that. All you do is sign up for a drug plan by itself. If you sign up for a Part D drug plan, a standalone drug plan, it knocks you off of your Medicare Advantage plan. I would just caution you not to do that without any backup plan as a supplement. And you can do the supplement search and all that during the next period of time, starts in January. Do drug prices and formularies regularly determine your recommendations on choosing Medicare Advantage over supplement? In other words, is drug coverage better through Medicare Advantage? Absolutely not. No. I'll tell you why. There are hundreds, I may be exaggerating, maybe just 100 Medicare drug plans, Part D standalone drug plans, and they're all tailored toward different people. And the best thing to do at startpartd.com, put your drugs in, put your pharmacy in, and let it sort all the different drug plans and tell you very accurately what your total annual out-of-pocket will be. With a Medicare Advantage plan, they don't have the liberty of saying, well, we've got this HMO for this type of person who only takes generic drugs. We've got this HMO for this type of person who takes very expensive tier 3, 4, and 5 drugs. We've got this kind of Medicare Advantage plan for a person who takes middle of the road drugs and it's going to be best for them. There is no such thing. The Medicare Advantage plan in your area for that company is what it is, what it is. It has a drug plan component smashed in there, just smashed in there, and whatever it is, it is. So the odds of you getting the best drug coverage for you, if you're picking a standalone drug plan tailored for you based on your drugs versus an all-in-one packaged Medicare Advantage plan with just a sandwich drug plan in there that's just generic, it could be good for you. It could not be good for you. Depends. The odds of you having a better drug plan experience with the all-in-one package plan versus one that you pick tailored for your local pharmacy of drugs that is in your medicine cabinet, your list of drugs, is very slim to none. So it's always better to have a tailored drug plan experience for you, which is why I encourage everybody to look at those drug plans every year. Let's see. There must be someone who can help this 71-year-old with health issues who knows that the Plan F is going to take care of my health, who cannot get no vehicle, no savings, renting. If you've not yet done so, Kathleen, you could, and I would not do it today, call Social Security maybe next week and ask about extra help. You may be earning too much for that, but you also may get extra help on your Part D and your Part B and even your Part B cost if your income is low enough to trigger that. The president's on TV right now talking about drug prices. I'm going to share with you a video as I check out today. It's a video about what was asked early in the live stream. I swear I did not set this up. The question was about that plan that I talked about months ago that's taking people off of original Medicare and putting them on private plans. There's ironically, the Young Turks, a hard left-wing news organization, talking about that particular issue with the Biden administration carrying on from where the Trump administration started that. So watch that video coming up in just a second. It might blow your mind. We'll try to do SHIP. Medicare extra help. Okay, just be very careful with the SHIP people. They are pushed by Medicare hardcore, and they're nice, well-intended people. The SHIP program, that's to help seniors. But they've been giving some really bad advice this season. And we have a lot of people that work with SHIP organizations across the country that refer people to us because they know that we're unbiased, and I appreciate that very much. But there's some of the organizations out there that are telling people you don't need a drug plan, don't worry about it, just cancel your Advantage plan, cancel this, just sign up for that. Giving advice without understanding the lifetime impact of giving advice based on not even having an insurance license. Like they told a lady 2 weeks ago, drop your Part D plan. You don't need it. You're not taking expensive drugs. Well, that could come back to bite that lady with a lifetime penalty. And the person at SHIP didn't even have a license to even tell them that information. So it's kind of scary. All right. Lastly here, you read my mind, she said. I called a little bit a week ago, gave all the information, got a text saying, go to the disability site, enter my information. Will someone call? Yes, as soon as we can. There's nothing we can do that's before 12/7 because of the late day in which the information was received. But man, I really appreciate y'all being here. I love doing these things. We'll do more of these in the future. I'm blessed by your being here, really. We've had a lot of people watching this thing live as we've been doing it. I'll continue to do it because I get so much joy out of helping people in real time. It's really fun. You don't see many agents that are taking questions in real time. So I was the first one on YouTube to start doing this stuff. I'll be the first one to do this live stuff, I guess. It'll be fun. It'll be really neat. Anyway, God bless you very much where you are. I'll make sure that this is going to play correctly. Don't miss this. This is something that's very interesting. I covered it before. It bears repeating, and we'll keep calling attention to it because it could be a very, very bad thing for seniors if this is allowed to continue under this current administration. And I'm keeping my politics out of it, but listen to what they had to say.
Former President Donald Trump began the process of privatizing Medicare. How awesome. But luckily, Trump is now out and we have a Democratic president in charge. And I'm sure he ended this effort to privatize Medicare, right? Except he didn't. President Joe Biden has left in place a program, a pilot program that began under the Trump administration that has the very goal of privatizing Medicare. Let me give you the details. This is known as direct contracting. That's the name of the program. The direct contracting program was established by the Center for Medicare and Medicaid Innovation during the waning months of the Trump administration, which included former pharmaceutical industry executives, Wall Street bankers, and right-wing policy consultants notorious for gashing public health programs. So great, I'm sure it'll work out well if the very people involved in crafting this program have a massive profit motive in mind, right? Now, under the direct contracting model, here's how it works. So-called direct contracting entities are paid monthly by the Centers for Medicare and Medicaid Services to cover a specified portion of a patient's medical care, a significant shift from traditional Medicare's direct reimbursement of providers. So let's stop for a second. For all those goons who pretend that they hate bureaucracy, that they want to cut out the middlemen, what this program does is implement middlemen who try to skim off or pocket some of the money that is provided in reimbursements from the Medicare system. That's how this program works. And they claim that it's more efficient. That's the lie that's being sold to Americans about this issue. So DCEs are allowed to, this is the part that's concerning, are allowed to pocket the funding they don't spend on care. An arrangement that critics believe will incentivize the private middlemen to skimp on Medicare patients, many of whom could be auto-enrolled into DCEs without their knowledge or permission. That's awesome, because our healthcare system gives us so many choices, guys. So many choices. The more you privatize it, the more choices you have. Choices like not being told that you're now being enrolled in something that you have no knowledge about. By the way, virtually any company, any entity can apply to be a so-called direct contractor, okay? Including investor-backed startups. So Wall Street investors are chomping at the bit. They're salivating over this. They love it. And Biden hasn't scrapped it. He has the power to do it. The Health and Human Service Secretary, Javier Becerra, he has the power to scrap this, but he hasn't. And the question is why? If the Biden administration is supposed to be so much better, so much more decent compared to the Trump administration, why are they putting this or allowing this program to remain in place? And by the way, not many lawmakers are even paying attention to this. But there is one lawmaker that I want to give a tremendous amount of credit to. She's not a Justice Democrat, but she's a strong progressive, and that's Katie Porter. Katie Porter has been trying to draw attention to this, and she talks about why this pilot program is such a huge problem. Let's watch.
This program was supposed to make Medicare more efficient, but actually it does just the opposite. Rather than allowing patients to go to providers directly under traditional Medicare, DCEs invite insurers and investors to step in and interfere with the care that Americans get. By adding in these intermediaries, the Trump administration undermined the very purpose of Medicare, which is to provide quality health coverage and increased financial security for seniors. Why would anyone want to overhaul this program? And the answer, as with too many things in Washington, is the greed of corporate special interests. This direct contracting entity model is just one more example of the Trump administration's many attempts to wreck a functioning, successful, popular.
Patients have suddenly been cut off from their go-to doctors. Austin Regional Clinic says they knew they would not be an in-network provider with United Healthcare beginning next year for Medicare Advantage patients.
But as KXAN's Eugene Cho explains, that change seemed to have gone into effect 3 months earlier than expected.
ARC says they've heard from thousands of their patients.
Losing access to their doctor in a period of 2 to 3 days is just not right, not ethical, and we're very concerned about it.
Or the customer service that you expect to receive. We have a pretty high standard on the companies that we choose. We don't want you to be potentially stuck with a company, for lack of a better word. If you're with a company that, you're in 2 or 3 years in there, and then something, God forbid, happens to your health, and you're stuck with a company. My question is, would you want to be with a name brand company that has a reputation of being in the market, being around for hundreds of years potentially, and hundreds of people to answer the phone and customer service when you call for a question? So then you just go to right where it says, go directly to plans. You skip a whole bunch of putting in your drugs to get an accurate number because they're going to be pretty much the same on the tier 1 and 2 generics. Pretty much all you're looking for is just a premium. So just your zip code in there, some premium.
So you need to take that off as well?
Thank you all so much for being here. Really appreciate it. More to come. Stay tuned.